see the bars going?
Bars going?
Okay, perfect.
Weird. Good afternoon, everyone. Sorry, excuse me. Good afternoon, everyone. Bonsoir, bonjour. Sego. We're going to begin this meeting with a moment of personal reflection. Thank you. We acknowledge that we are gathered on the traditional territories of the Haudenosaunee peoples, the Mohawks of Akwesasne, the original keepers of this land. As settlers, we are grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. Council Gardner, can I ask you to lead us in the singing of our national anthem, please?
O Canada, our home and native land, you patriot love in all of us command, car ton bras sait porter l'épée, il sait porter la croix. Ton histoire est une épopée des plus brillants exploits. God keep our land glorious and free. O Canada, we stand on guard for thee. O Canada, we stand on guard for thee.
Thank you. Can I have roll call, please, Madam Clerk?
Mayor Justin Towndown,
Present.
Councillors Claude
Here.
McIntosh, Maurice Dupel,
Present.
Sarah Good,
Present.
Caroline Hébert,
He's out.
Councillors Elaine McDonald,
Present.
Sid Gardner,
Here.
Councillor Denise Abourin sends his regrets, Mr. Mayor, Councillors Todd Bennett,
Here.
and Frank Goujo.
Présent.
Thank you.
Thank you. Just for clarity, we're continuing our budget meetings. Do we need to re-adopt the agenda?
No.
Okay.
Just resume, Mr. Mayor.
Resume. Okay. Any declarations of interest, disclosures of interest for this meeting?
Oh, sorry. Yeah, sorry.
Councilor Hebert?
Yeah, thank you. Same as the last two meetings. A little distraught right now, sorry. I will declare conflict of interest for the Social Development Council and any of its related debates and conversations.
Thank you. Any
Thank
further-
you, Councillor Hebert.
No, it's okay. Any further disclosure of interest? Councilor Dupel?
It's not a conflict of interest, but it could be perceived as chair of the Agape Center. I'll declare conflict of interest for the last resort funding as the Agape Center has been administering that fund. So,
Thank you. Any further disclosures?
So maybe, Mr. Mayor, if I can ask when the time comes and there is the conflict to just leave the room? Thank you.
Thank you. So we'll pick up where we left off. We're starting with a presentation from the EOHU, I believe, Madam Clerk.
The finance has control of that presentation.
My apologies. Ms. Bailey.
Yes, through you, Mr. Mayor. Yes, Dr. Paul and Dr. Gagnon will present for Eastern Ontario Health Unit. That's on page 178 of your book.
Gentlemen, welcome back to council.
Thank you very much, Mr. Mayor. Good to be back. It's been 4 years. I haven't been face-to-face with any of you. I think you know why. So just going to give you a bit of a preamble. I was asked to just give an overview. I think you have the line items there. Give you a bit of an overview of what happened over the last 4.5 years to public health funding in Ontario. Just to give you a bit of a historical context, in 2018, 2019, the Ministry of Health and the government decided that they would go from 34 health units to 10, and that they would eventually downshift the cost sharing from 75-25 to 70-30, and then 65-35, and then 60-40. There was a great deal of pushback from us. At that time, I was president of the Association of Local Public Health Agencies, and we pushed back a lot. We decided that we should meet everybody, and then something happened in February of 2020 that stopped everything. So basically, the pandemic stopped, those further deliberations. Had they not stopped those deliberations, we would have been in the middle of merging right at the onset of the pandemic. So that was a good thing. So the other thing they did not stop, however, was the the change of the 75-25 to the 70-30. And so at that point, what they did is they calculated even more programs. As you know, there was most of the programs that we have are cost shared, 75-25 between the municipalities and the ministry. But there were also some 100% programs that they kind of lumped into everything. So they came up with a sum, significant sum, that represented that 5% extra. So it was not just 5% of the programs that were previously funded, but it was 5% of programs that were 100% funded previously. That was around 1.7 million, I think it was, or mitigation, 1.5. 1.2, the mitigation for that was about 1.2 million. And so the municipalities, again, at AMO meetings and Roma meetings were pushing back at that point. So the government said, okay, you know what we'll do? On paper, we'll make it look like a 70-30, but you'll still pay your 25, but we'll add that 5%. And so they basically added one-time mitigation funding to that, which was $1.2 million. And they were doing that for the 4 years. And on top of that, we had extra COVID funding. At one point, we had $10 million extra of COVID funding for the vaccines and so on. And so they now have said, well, okay, we're going to stop your COVID funding as of December 31st, 2023. You need to, deal with it on your own. COVID's still around, as you know. We've had 50 deaths in our area just this past 6 months. And so they said, yeah, what we'll do now is we'll take that 1.2 million and we'll put it as our base budget to you. So essentially what they did is they increased their portion by downloading that amount. So it worked out to, if we had not done anything different, it would have been an 80-20 split. That would have left us in dire straits with 1% increase and facing a lot of increases. And so when we looked at those numbers and looked at other health units, a lot of health units were, the municipalities were paying more. I have a history of respecting the 75-25, never more. And so we had multiple board meetings, multiple back and forth with municipalities and so on to explain that there would be a bigger increase this year to even it out. Otherwise, we would have a lot of issues. We'd have to let go of people, and we would still have to face COVID. And we still have to catch up with a lot of the issues, catching up vaccines, as well as the mental health issues that are around, and catching up on a lot of the programs that we need, particularly in this area. Primary care as well is another one. We continue to deliver well baby care. There's no other person to do it, so we do it ourselves. And so we decided, and we wanted to just bring back to the 75-25 funding. Just to remind you as well that if you look back historically, municipalities were actually paying much more. And so it's now the increase that we're looking at and was approved by our board and already sent to the other municipalities is going from 729,000 in 2023 to 890,000, so 161,000 more than as compared to last year. This is not a yearly jump. This is just to bring it back up to 80%. This really represents a download from the government. That's what it is. And so, we vigorously try to, is there any way? I looked at the ministry and I said, well, can we get a one-time funding to make it easier? No. And so, they're now on merger, merger funding. They said, if you want funding for merger, we'll give it to you, but not for that. So we had, many deliberations. I have good relationships with all of you. We have good relationships with all our other partners, ST&G and Prescott Russell. Explained it to them. They were on board. Our board unanimously approved it. And that's what the explanation is for the increase. We have to recover. We have a population, particularly in the Cornwall area, that has high needs in terms of medical needs, mental health needs, catching up on vaccines, and so on. And so we need to continue those programs and at the same time absorb whatever costs we had for COVID that are now not given to us extra. We estimate that last year our COVID-related costs were in the $1 million range. Previously, there were 10.2 million, because that's when we had all those arenas going, if you recall. And so, if you take that all there, we now are able to function and move forward with that increase. Again, I want to stipulate very, very clearly that we were not happy with this. I've fought. In fact, I'm one of the proponents of trying to get municipalities out of funding public health. I've spoken to the Premier directly about it. I've spoken to others, but that's for a future time. But for now, this is not going to increase disproportionately moving forward. Whatever increase we get, 1%, that's been, I think, guaranteed, that'll be the increase. So it's a jump. I know it hurts, and people are saying, well, it was like that for the last 4 years. If you look at the numbers in historical, that's because we had COVID funding and we had extra funding, so we had that maneuverability. Since they cut it, we've got to absorb it. And so that's where we are. I mean, the line items are the typical ones that I always present to you, so we have to look at that. So if you have any questions, I'd be more than happy to answer them. But I just wanted to actually take this opportunity, if you don't mind, Mr. Mayor. It's a bit off topic, but thank the council and all staff in Cornwall who were very helpful during the pandemic, particularly when we were using Benson Centre. We vaccinated, we're almost at 700,000 people that we vaccinated with COVID. Vaccines, a lot of them in the Cornwall area. As you know, we had a big clinic, so we're one of our bigger ones. So I want to take this opportunity to thank everybody. I know previous councils were also there, but city staff were extremely, extremely cooperative, and for that we are very grateful.
Thank you, Doctor. Thank you for your presentation and your kind words. The city was very happy to step up as needed in such a circumstance, and we're always here to step up. Hopefully we won't see anything like that again in the near future or in our lifetimes, but if we do, we're here to step up as needed. Thank you.
Mr. Mayor, and one of the things that we're worried about, we want to be prepared for the next one, so we need to ramp up our staff and make sure that we're doing that, and that's one of the reasons that they're trying to look at mergers, to have more of a base in terms of capacity.
Thank you. Are there any questions or comments? Councillor Gardner.
I pretty well know the numbers.
Microphone, please. Thank you.
I pretty well know the numbers. I've sat in on a bunch of, I'd call it audits. But Dr. Paul, I think I would like to say that we now have a dental clinic for seniors, which was missed there. So I know it's just, what are the rules that works by?
Thank you for bringing it up. Mr. Chair, I call him Mr. Chair because he's my chair. So the Cornwall project was something that's very dear to my heart. We knew there was a big gap. We had a clinic in Seaway Valley, a health center right across the street here, that could no longer keep up with the need because we added the seniors. There are certain income requirements to seniors, of which many fall into that in our area. And I struggled. I had many meetings. And just to give you context, that this clinic was fully funded by the ministry. This does not cost the city of Cornwall anything. It was upwards in the $700,000 range that we had to build a clinic. And that was one-time funding by the ministry, including the renovation of the parking in front to allow more handicap parking in front of us. That's all funded by the ministry. So they paid some of their share. So at least I want to give them credit. That clinic that we have now is for seniors. We have a dental program called Healthy Smiles Ontario. It really is driven by income. And so we are delighted to be able to offer it to Cornwall. I know some people don't fit some people say the threshold is a bit too low for that, and we're working on that at this point. We think that it is low, and we're trying to get it up. But nevertheless, we have a tremendous amount of seniors taking advantage of this program who otherwise would not have access to dental care.
Thank you very much for that answer. I have another question. The area is short on doctors. So what could we do as a community to enhance what we're doing now to be able to attract doctors to this area?
It's a very difficult question because you're not the only community. There's 400 municipalities out there that are struggling as well, and this is a national problem. I think that a lot of the let's talk about just living in Cornwall. Let's talk about the area. I mean, there's a lot happening in Cornwall. I always thought that Cornwall was a hidden gem. I always thought that Cornwall had potential of attracting people to live here and to work here. I think, and that a lot of things are happening, and I think that's good. Housing is another issue. As you know, there's a big housing shortage, so if you have houses, they build it, they will come. That's one of the things. So if I'm a physician or a healthcare provider, you'd like to look at that. I think the other one would be like, are there incentives? What is the reason for us to work in Cornwall versus in Ottawa versus in Montreal or whatever? And that's a hard one. It depends on people's lifestyles. It depends on people's ambition and clinical role. We need family doctors, and there's a shortage of family doctors. So is a limited pool. I think you have scholarships. Can you promote, scholarships and return of service? Those are things. As I've seen SDNG have ads on CTV about winning $5,000. I don't think anybody's going to want to win I don't think it's enough, but that's my personal opinion for that. I know that we had, when Jean-Marc Lalonde was MP for the Liberals at that MPP at that time, he had a rural health sort of committee going around, and they were perplexed why Cornwall wasn't able to attract physicians given its location. So I'm still perplexed. I think it's a great place to practice, great place to work. So what do? It's a joint effort. As much as you can do, offer carrots and offer incentives as much as you can, but it's also the responsibility of the ministry as well to kind of look at what the gaps are, where the gaps are. Like I said, we have to offer. I'm now working with Ontario Health because there's not enough people to see young babies who are born. So we do that at the health unit, and I'm trying to get extra funding for that. But that's sort of a patch. That's a patch for us. You
do feel it's the province that should get involved?
I think the province needs to get involved. I think
some funding. Yeah.
Some funding or some kind of incentive. I know that when I was in Quebec, I practiced in Quebec, there was a big incentive for me to go to Baie-Comeau. I trained in Montreal, was born and raised in Montreal, and I went to Baie-Comeau because there was actually an incentive to go to Baie-Comeau and a disincentive to stay in Montreal, believe it or not, for the first 3 years of your practice. So there are levers that the ministry can do, and obviously in tandem some complementary efforts that the municipalities can do as well from what they can control.
Thank you very much, Dr. Paul.
Welcome.
Councillor McIntosh?
Yes, Dr. Paul. You touched on a dental plan for seniors. I got a letter today from the Department of whatever the feds are notifying me that I could qualify for the plan because there's a threshold. Is that going to affect your?
Yeah, it will. We still don't have any details of how it's going to be rolled out. In fact, I was in Toronto on Friday, and I asked the Chief Medical Officer of Health. They're still working at how the feds are going to administer that. If they administer through the province directly, then it's going to make it easier. They're going to lump it into our programs, but they're also going to give some lump sums to be able to go to and pay dentists as well. So we still don't know how that's going to work out, but we're waiting to see how that will. Hopefully, it'll blend in nicely and complement what we have because we already have the infrastructure in place.
My letter said Sun Life.
Okay, so they're going to have Sun Life covering you.
Yeah. If you qualify. Touching on what Sid just talked about, family doctors. My wife's family doctor has notified all his patients, probably 1,000 of them. He's done at the end of this year. Of course, the scramble starts, and I read in the Toronto Star that there are 1.6 million Ontario residents without a family doctor, and the experts expect that to grow to 2.8 million in the next 4 or 5 years because the population is growing, fewer people coming to med school and whatnot. So that's going to be a problem. That in turn puts it on the ER units. The interesting thing here is, I think I'm right about this, hospitals have an easier time recruiting ER doctors then municipalities have a recruiting family doctors. Are you hearing that?
Yes, I am, because it's easier just to go in and out rather than to set up a practice, and that's the reason. And so I hear you about the family doctors, and I can tell you, back when I was in Montreal, I was part of the, I had just finished my pediatric residency, had gone to Baie-Comeau, I came back, and at that point in time, the government decided that there were too many medical students and too many residents in pediatrics, and so the Montreal Children's Hospital typically had 40 residents every year, and churning out a lot of pediatricians, and brought it down to 12. And we told them that, in 10 years, 15 years down the line, cutting the number of, when I graduated at McGill, it was 160. Now they went down to 100, if I'm not mistaken, 120. And all the universities did that because the government cut the positions, and we're paying the price for it now. I'm sorry, but we are paying the price for it now.
Yeah, my theory on this, my family doctor is only 54 years old. He's down to 2 days a week. His wife's a doctor in Ottawa. He lives in Castleman, comes to Cornwall. Really good doctor. But you can see he's phasing himself out.
Yeah. They're under a lot of pressure as well. They have a lot of patients and thousands of patients, and I know that they're burnt out. I know that they don't have enough help. I think one of the things that we should be looking at, instead of like family doctors, have family teams. That people that can help, nurse practitioners that can help, that can give a team approach rather than one-on-one. Because if one person takes on hundreds and thousands of patients, it's quite onerous, and it's not only difficult for the doctors, but also for the patients if they can't reach that doctor. So we're looking at now more and more of having allied health professionals as a team, nurse practitioners, nurses, dietitians, psychologists, whatever you need to have, that will then offer a bit of a follow-up, and that's what they're trying to achieve, but that's going to take a long time to go. The other problem that we have in Cornwall, and I remember knowing that there's a relatively high percentage of physicians that are working in Cornwall and in Hawkesbury that actually live in Montreal, and they come back and forth. And so it's difficult for them to, put roots down here. So I think that's another problem that we're facing in this area.
I guess my approach now is, knowing that someday I'm going to get a letter from probably my family doctor, is to start taking care of yourself. Be your own advocate when it comes to health. Give yourself all the breaks you can.
Yeah, make it as difficult as possible for you to need a physician in the future. But that's not reality, because you have accidents and so on.
Councillor Hollingsworth.
Just one question, and it's not so much related to your budget, but it's kind of piggybacking on Councillor McIntosh said. I read an article in Maclean's magazine a little while ago that suggested a lot of practitioners, general practitioners, are overwhelmed with the paperwork, that they're doing their 40 hours of taking care of us being sick, and then another 30 hours or whatever it is doing administrative paperwork stuff. Plus, if they run their own shop, they've got to pay for somebody to answer the phones and to meet the public and all that kind of stuff. In your opinion, does it make sense for us as a municipality to consider creating our own clinic to provide the bureaucratic part? Like, if we're trying to attract a doctor, if I give a doctor $100,000 to come to Cornwall and they say, great, and we give them money for 3 years, and when that 3 years runs out and then whatever their contractual obligations, they can pack up and leave. If we took the administrative burden out of being a general practitioner, a family doctor, if you will, if we took that responsibility away from them and said, we'll do the bureaucratic stuff, you just take care of sick people, do you think that might bear some fruit?
If you build it, they will come. I really think so, but it's hard to see a municipality getting into that business. But I do know that we're working on something in Alexandria, and we are trying to get some healthcare providers into our Alexandria office, for example. We have a vacant space in Alexandria, and they have told us, if you build it, we will come.
Right. I've heard of some, and I can't remember where, that have pursued this. I mean, here's my thinking. If we're going to pony up $100,000 or $150,000 to try to attract physicians, and then they come and they leave, and wouldn't it be better to potentially take that 150 or whatever that number is, and potentially maybe have to bump it up a little bit, but use that money to make it easier to be a doctor in Cornwall. Rather than give you the money, you spend the money, and then you leave, wouldn't it be easier to take some of that burden of being a practitioner away, conceivably making it more attractive? So instead of using the money for this, we use it for something else, still with the objective of luring and keeping doctors in the community.
I think theoretically it is. I'm not sure at what point what the cost level would be
I
to
don't know
maintain
either.
it.
Certainly that's an investigation, I think.
Because you're looking at sort of an annual recurrent cost, of once you built it. Like
Right.
what are your administrative costs? What are your operational costs? Because if you're running a large clinic, I think it's going to be more than $150,000
I'm
a year.
sure it will be, no
So
doubt.
that's the issue. That's the issue. How do you get that funded?
Right.
And so those are the challenges that municipalities have. That great if you can build it, but maybe you can get somebody else to build it, and they will come.
Well, potentially, sure. And maybe that's the trick. I mean, we listened last night to a lot of community groups that tell us they do great stuff, and we're going to probably help them out. Well, I think most of us would agree that healthcare is probably the most important thing of all of the services we can potentially
Agreed.
provide. So it's all nice to say, wouldn't it be great if we have this, and wouldn't it be great if we have that? But if we're sick, that really doesn't amount to anything.
Yeah.
So anyway, that's not probably for this year's budget, but certainly it's something.
I think it's a good point. I think perhaps one of the things would be to incentivize others to build it.
That's the plan.
And manage
We'll
it.
keep-
And there are some people in Cornwall that might be interested in doing that. As
Potentially,
you know.
sure.
As I know them. I know them as well. So I'm trying to get them to build elsewhere as well. So.
Yeah. Well, as the French say, bonne chance. Thank you, Your Worship. Thank you, Dr. Paul.
Councillor Hubert.
Thank you, Mr. Mayor. I have a solution to all of Councillor Hollingsworth's concerns or suggestions. It has already been built, and so we don't need to build a new clinic. Both Centre de Santé Communautaire de l'Estrie and Seaway Valley Community Health Center across the street from us operate a fully functioning clinic, administration, overhead, all of that. They have capacity to bring in new doctors. They don't have the funding. So I don't think there would be a need for us as a municipality to build a clinic. From what I'm under the impression of is that they have the facility, they have everything there to get going. They could use more doctors, and they need money for those doctors, right?
They could use more doctors, but they have very narrow criteria for their clientele. So within that clientele, they try to stretch it a bit. Like they can't, or the babies. Well, baby care is not their mandate, but they're doing it because I asked them to do it to help us. But yes, you're right. But again, that is a very narrow kind of approach. You'd have to have more room, and I understand. I know Mark. I know them very well. I work with them all the time, so I know their challenges. But yes, you're right. So there are ways, either others or entice others to build it, because I think that's the only way. And the other thing too is, in terms of a prosperity of a city, the more healthcare resources you have, locally, the more people are gonna say, "Oh, I'm gonna buy a house there, not there," to come into the city and increase your tax base. So, I think I agree with you, but there are these limits, and that's what we're trying to do. And there are these silos. And when I speak to Ontario Health, they have a mandate there, they have a francophone mandate, and it was hard for us to even during the pandemic. They helped us, but it wasn't their mandate. But they helped us,
Right.
obviously.
Because you came with funding, of course.
Well, of course, yeah.
Right. And
But-
we could possibly do the same thing, right? We can come with funding, and it may expand their mandate. And I know for the most part they're serving vulnerable people and
Yeah.
whatnot. But I think instead of waiting, the year and a half to build something, we could right off the bat
But
maybe
I don't
get started.
think they have the capacity to fill all the primary care gaps. That's the problem.
Oh, I don't.
at
I'm
this
not
point.
saying it would be the only solution.
No,
I would
but
be
it's one of them. No,
it would be a quick win.
It's a quick win, and we're working with them to see what we can do, and we're working to see how they can decongest emergency rooms. Like we're looking at all of that. Don't forget, one of the other things that's missing is after-hours care, after-hours non-emergency care. And that's one of the things that we're challenged with, to see, can we, how can you recruit people? So I am working with some of the hospitals to kind of see, can we have an off-site after-hours care using your same admin and EMR? So those are the type of solutions we need to be doing, because that's why they're overwhelming our ERs, our emergency rooms. as well. It's a multiple.
Oh, yeah,
issue.
there's
It's
no
not-
one quick fix, but there
No.
is a dozen solutions that we could be working
Oh, yeah.
on at the same time. But I think the team-based model is a great
Yeah.
approach because
Yeah.
especially new doctors, they don't want to be administrators, they want to be doctors. They don't want to do payroll, they don't want to have to take care of staff. They want to go in and help people and have somebody else do the overhead. And so if we are investing in more of those team-based models,
Yeah.
which is basically what Councillor Hollingsworth is suggesting, then
Yeah.
absolutely. And then the lack of walk-in clinics, I think we may see less of a need of those if we have more folks attached to family
Well,
care practitioners or nurse practitioners.
Well, who offer after-hour services,
Well,
that's
that-
another
yeah,
thing as
that-
well. You know, that's another thing. You need to have, to build in, lock them in. If whoever comes in and you give them an incentive, you say you need to provide after-hour services as well, because a lot of them have obligations to do so, they don't do so. So it has to be built in, because you have to look at the whole system, you know. And by the way, you know, as a public health practitioner, we practice, you know, we know that, you know, eating healthy and so on. And we also know that one of the important social determinants of health is the proximity to healthcare services and accessibility to healthcare services. So it is a public health issue.
Absolutely.
Councillor McDonald.
Thank you, Mr. Mayor. So I just want to say, Dr. Remiliotis, I've heard you speak a number of times, and I'm always impressed by the breadth of your vision and your grasp of, seems to me, the whole healthcare sector. So thank you for your advocacy, and thank you for the budget you brought, because if you didn't bring in this increase that you brought us, we would simply be limiting services, which seems to be what happens. The provincial government downloads, and
Yeah.
people don't feel they can pick up the slack, and so service is lost. And thank you for being a champion to make sure that doesn't happen. Now, I just want to say that, touching the points that Carolyn Niebuhr made, and also Dean Hollingsworth about capacity and clinics, I listened to the pre-budget hearings that the provincial government conducts, and I know, Mr. Mayor, you were there speaking about good roads, and I listened to the healthcare presentations made by the nurse practitioner clinic in Lancaster.
Yes.
And our own Erin Kaloran was speaking virtually. And their base funding, I understand, has not increased in over 10 years. So we know what's happened to inflation.
Sure.
So the government literally has our public health resources on a starvation diet,
Yep.
waiting for us to clamor for the opening of a
Private clinic.
for-profit clinic.
I know.
And further
I understand.
weaken and dismantle the public healthcare system. So I thank you for being a warrior to
Well,
maintain a strong public healthcare
I
system.
appreciate that, and I can tell you that, you know, public health is not, itself has been flatlined as well, as you know, for many years. Like, they just told us, oh, you're gonna get 1%. Ooh.
Makes no sense.
You know, and they guaranteed us 1% for 2 years or 3 years. You know, but we were flatlined for many years, and and even with previous governments, we're not talking partisan here. We're talking
Yeah.
about governments that
Yeah.
really. So what does that do? I mean, when I inherited the health unit, and by the way, I'm starting my 18th year here. Can't believe how time flew. You know, when I inherited it, at that point, we had 230 or 240 staff. We're down to 185, you know, and we don't fire anybody. That's attrition and not replacing. There's no other choice, you know, and so we're struggling with that. But they've done it to the nurse practitioners. I know Penelope very well. I know them, and we're advocating for them. I'm advocating for more nurse practitioners, because that's another model, you know, that's outside of the box. It's not. It's a model that works, you know. And I've been trying to help them. And by the way, they help us a lot too, as you know. We receive, and you know, all the NAV Center, you know, evacuees, and they're the ones. It's the Centre d'Estrie, it's Seaway Valley, and Penelope's Clinic that help us provide primary care to those individuals. So I know them very well. I know their gaps and I know their needs, and I'm trying to advocate for them. Whenever I go to Toronto, I know the Ontario Health people very well, and I try to advocate for that. And in fact, we did get a nurse practitioner funded for well baby care. So at least we got that in the Cornwall area, the biggest need.
Councillor Gunjo.
Thank you, Mr. Mayor. I have a general question for you. I would like to know what your organization is doing to recruit newcomers, doctors that we have in the city. For example, I know that we have some of new residents that are in Devco Hotel. They are doctors for other countries. And I don't know if you are in contact with them or are you interested to.
Well, my mandate is not, I don't recruit, that's not my mandate at the health unit, but we, because of, I know a lot of people, I kind of interject and put people together. If there are people there that are qualified, we have now different, less stringent international medical graduate regulations. I'm very familiar with the people in Dev Center because we're the ones that take care of their health needs and as the transition goes. So that's a good idea, but I was not made aware that they are, but that's something that we could look at. Again, it's not us that are you're making the decisions. They have to go to regulatory. But whenever if there's a need for me to help or to recommend somebody, we will do that to maybe make it quicker with the college because it's also about expediting it. It's you don't need them in 5 years. You need them now.
Yeah, you're right. Another question about what the role of EOU for medical recruitment in our city. Are they to influence the system of planning or?
No, what we are the health unit in Ontario health units have specific mandates through the Health Protection and Promotion Act, and it's broken down into multiple programs. One of the most important ones is getting the information and surveillance and data and providing it to others, providing it to hospitals, providing it to recruiters, and so on. And then we have other buckets of infectious diseases. So, for example, we run COVID response. We do any investigations for infections and so on, working with the hospitals. Vaccinations, we distribute the vaccines. We also have the food and water safety program, so our inspectors do the food. So we have it's a more of a public health lens rather than a recruitment lens, but our data and our insights provide data and inform decisions, inform hospitals where the need, where the gaps are, and so on. So we have an indirect role, not a direct role.
Thank you very much. I would like to understand what is going on here. What is the city role? Why are we in the medical recruitment? I would like to understand the role that you gave to the city on this area.
I think that, again, one of the most important determinants of making somebody healthy is access to healthcare. One of the attractive features of going to one region versus another is availability of healthcare. Like you have a hospital here, you have mental health services. If you have more family doctors and people know that, you'll attract them. So that's, to me, that is one of the reasons why municipalities should be involved. But as I said before, I think it's a shared responsibility. There are things that a municipality can do to make it more affordable or more likely that a health practitioner would come. But it's also incentives that could be given by the provincial government in terms of fees and bursary, all that other stuff that could be done. Cornwall's not the only town, as you know. Other cities are having the same issue, and not only in Ontario but across Canada. So I hate to say it, it's competitive because there's many places and a few people to fill them. So cities need to put their best foot forward as much as they can. Again, within their, like I said before, providing, a nice place to live or things for their kids, good schools, like all of that thing has to come into play. And one of them, to attract people in general, is, do you have healthcare accessible? What's the healthcare situation in your area? So the more that you have to offer, the more likely somebody will move here. So that's from the city's point of view. But also the city cares about the health and wellness of their population. And that's why we're here. We're here. You're funding us in part because we try to get the best out of in terms of preventative health promotion, health protection. But there's also the other aspect of acute care and ongoing primary care, which is missing as well.
Okay, thank you. Last question. Comparing the healthcare system from one city to another one in the province, what is your what do you think about the position of our city of Cornwall compared to all those?
I would say it's at an average level. I don't think that it's more or less off than others. They're all low, if you ask me. There are some cities like Kingston that are a bit higher because they have a university that's do a lot of teaching, whereas we don't here, and that's I think the disadvantage. But if you go to Leeds Grenville, if you go to Hastings, Belleville, it's kind of the same. I think we're at the middle of the pack. We're not the worst off, but we're certainly not the best of the lower ones.
So if I get you, having a university can be an incentive for,
Yeah.
it can be something
Yeah.
positive
Yeah.
for the health.
Yeah, because they can teach there, and they could do research, and it attracts more people to the area, more people that can practice, and people that would do perhaps, if you have a lot of professors, they can do after-hour clinics, for example, that type of thing, if they're physicians. So I do believe that's why Kingston has more primary care than we do in our area, and they have, again, it's not more than us. It's if you compare Kingston to us, Leeds, like all the health units around them, they have more because it's concentrated because of the university. They have a medical school there.
Okay, thank you very much.
You're welcome.
Councillor Good.
Thank you, through you, Mr. Mayor. Thank you for your presentation, Dr. Paul. I have a few questions for you, and I wanted to build off what my colleague was asking about in terms of medical recruitment. It's my understanding, and I could be totally wrong with this, but that in Ottawa, there's a collaboration being done between public health and the hospitals to work on recruitment and planning. Are you aware of how that work is being conducted, and is there any discussions on implementing a similar model in our region?
I'm not aware, but I will essentially look into that. I can also tell you that we work very closely with all our 4 hospitals in our area, and if there's an opportunity for us to help them with recruitment, we would. I don't see how much more we could add, I'll be honest with you. And I know how Ottawa Public Health works. I know how the health units work. I don't know how much more we can add, what role. I'll speak to Ottawa to see. I know them very well. But if there was an opportunity for us to be helpful partners in that, we would absolutely, help out. As I said, I meet them regularly, and I'll bring it up the next time I meet them. I meet the CEOs here.
Wonderful. Yeah, that'd be great. I have very little information about it. It's
Yeah,
just
I don't
something
know
that-
much about it either. I just know, like I said, our role, we're not positioned to do that, but if we can provide support, if we can provide information or data, like sometimes they need to be informed as to what the challenges are, and we have the data for that.
Another question related to the merger that you were discussing earlier, and
Yeah.
you might have already I understand that the pandemic kind of threw a wrench in things.
Sure.
Do you, those conversations are restarting again, if
Yeah.
I'm correct? How do you see that playing
Okay.
out?
They've changed, okay? The original unilateral decision, as a matter of fact, we found out on the budget day. Like, nobody told us. All of a sudden, we look at page 365, and they said, yeah, by 2019, we're going to have 10 health units instead of 36. And that meant for us that we would merge with Ottawa, Kingston. It was like even Ottawa, and we didn't want that because that would be impossible to do because of different structures, and 4 other health units. And they would do that within a year, and they would download 75, download to the ministry, to the municipalities. So that was a compulsory, mandatory, here are the regions, done. We dissuaded them, and I had meetings with the ministry. I've actually had meetings with the premier himself on this, and said, you know what, yes, there are some health units that are very small, that are struggling, that don't have MOHs, that don't have epidemiologists, that are less than 100 and 150,000, that probably would be better off to merge, and there's a few that already had merged. And so we said, you shouldn't force us. If they need to do it, they can look at it. And so they agreed, and then they said, well, you know what, maybe if we look at strengthening of public health, like if you take a couple of health units and have a mass of 500, 600,000 people, you have more of a budget, you have more human resources to be more ready, and you can do joint savings. You have joint savings, and those savings will be re-injected into public health. That's the difference now. The other one was cost cutting. This one isn't. So now they changed it. Before they called it modernization. Now they're calling this voluntary merger as part of a public health strengthening, where they're trying to look at where can you save resources, where can you do pooling of purchasing and back end stuff, and re-inject it. It's not going to go back to the government. It's going to go back into public health locally. So the premise, I think, is a good one, and so. We're all looking, we're all sort of examining it to see. And so the only problem is that the timelines are a bit ridiculous. They want us to have a proposal by April 1st this year for mergers beginning next year. Now, the other problem is, as you know, when you have mergers, let's say 2 health units merge. That means you're merging 6 unions, because we have 3 each, right? So wage equalization itself is going to cost millions of dollars. So the whole thing is going to be cost. So one of the things that the ministry has told us, they're paying for it. So they're going to pay for it. And how long are they going to pay for it? Like, are we going to have ongoing? But they have funding for this. So let's say whatever it costs, they'll pay for it. So they've added that. It's not going to be a burden to us. But again, so we're looking, what makes sense for us. What makes sense for us. We have a bit of a unique. So looking at other health units and looking at who we service, parts of our population are 80% francophone, which includes 30 to 40% in Cornwall. We have a very unique relationship with Akwesasne. I'm the medical officer of health legally of Akwesasne, including the Quebec side. Like, it's a bit of a, that's a very different than other health units. And as well, we have NAV Center, and we receive all the time, it's DevCore, whatever, but we always receive evacuees. So we have a lot of different nuances. So we're different, and other health units are looking at us and saying, well, oh boy, like kind of looking at us. So we're now looking at, we've discussed at our board, nothing's firm. We're just looking at feasibility. Is it feasible for us to merge with X, Y, and Z? I know some health units have announced that they're looking. I think it's premature to announce it. Like some health units, Kingston, Belleville, and Leeds have announced that they're looking at a 3-way merger. I think it's too early to announce it because they have to make a feasibility assessment. Like, how feasible is it? Look, it's a very complicated process. They have to look at, all of your union agreements, your salaries, your job descriptions, your properties. Like, we own properties, we lease properties. There's a whole slew of things, obligations, liabilities, assets, and so on. So it's very complicated. So they're expecting us to make a proposal by April 1st. And I'm not going to live by or die by that. If we can't, we can't. We're going to, and we're not the only ones. Other health units are saying the same. We don't disagree with looking at it and looking at where it makes sense to merge. But I told them, I think it's almost cruel to, not cruel, but it's really difficult when you have a burnt out staff. Like 70% of all public health staff are burnt out. We're trying to recover our programs. We're trying to recover our vaccinations. We're trying to recover all these things. Now we're sort of looking at mergers. I said, maybe you could have waited a year. Give us a break, to sort of recover things. But anyway, that's how it is. I doubt very much that all health units or the health units that are looking at it will be able to say, oh yeah, this is a proposal for April 1st. I doubt it very much.
Yeah, it's definitely not a simple process.
It's not
to
simple
merge
at all.
things together, but interesting that those conversations are taking place, and I hope that if those 3 merge together, that it wouldn't prevent us in the future from embarking on something similar.
Well, like I said, it's not guaranteed that they're going to merge together because the ministry wants contiguous, leave. But again, we're looking at other combinations and permutations. Okay. But if we're left alone, we're left alone. Mm-hmm. But I do agree, like the more mass you have and the more back-end sort of savings, it's the better preparation for you.
Yeah, you cut on IT, HR, finance, all that kind of stuff. I'll be interested to hear back, and hopefully some of the conversations with Ottawa Health, maybe they're doing something that we can take a note from and work on our own recruitment. But like you said, it is a national problem. So thank you.
Thank you.
Councillor Gardner.
Thank you, Mr. Mayor. There's 2 points I want to make. I don't know about the budget next year, but we're going into negotiations with 3 unions. And we've been flatlined at a 1% increase in the last year or two, flatlined for 2 or 3 years. how the heck are we think we have a problem with the unions here in negotiation. We don't have the money to negotiate with. So that could be a major problem. The other thing is, at the merger meetings in Kingston, when we were told that it would have to be done by March, I don't know if I can say that here, but I said, it ain't gonna happen by March. What we wanna do is bring in a consultant who will go to at least 3 of the different health units and come back with, we've already had, 500 questions or something? So, and come back with how we can do this to make sure that the health units make out well with this merger. And as the doctor said, if we have to go on our own, we will. At the end of the day, the province will agree or not agree to what we're doing.
Yeah.
Thank you.
Thank you. Councillor Gardner, could I just get you to clarify, you were speaking about the unions related to healthcare and not city, you were talking about unions related to healthcare and not internal city unions? Okay. Thank you. Any further questions or comments? Okay, seeing none.
I just wanted to say one more thing.
Yes.
One of our main tenets of merger would be preservation of local services, local locations. That's something that's guaranteed. And local jobs, obviously, because our staff are worried about that. But to me, it's looking at what's best for our community. That's really so any decision, any feasibility, yes, there's financial feasibility, but there's also feasibility looking at the quality of services and if they're going to be affected at all, particularly our ability to service francophones, which is very important for us. All that has to be maintained. So we want to improve, not be losers. We want to be winners at the end of the day because we're looking at it on behalf of our community.
Thank you very much. And thank you for your presentation.
Thank you.
Ms. Bailey?
Thank you, through you, Mr. Mayor. Our next, we'll continue our departmental budget presentation. So page 144, bylaw services and parking programs. So we'll invite Mr. Fothrop and Mr. Bray to present. Thank you.
Whenever you're ready.
Okay, thank you. Good afternoon, Mr. Mayor, members of council. We'll resume our Planning, Development, and Recreation Department budget presentations on page 144. To my right, our Chief Building Official, Mr. Charles Bray, will be available to answer any questions after I run through our operating budget and highlight some of the variances and reasons for those variances. So you'll see our salaries and benefits for our bylaw services division has been reduced by $18,000. This is a result of, we have added a supervisory position to the department, but the increases resulting from that added position are offset by a transfer of staff from our bylaw department to our building department. So you'll see a corresponding increase in our building department salaries and benefits. For our purchase of goods, you'll see a moderate increase of $3,600. That is largely related to some planned purchase for office furnishings as well as some new uniforms for new staff. As well, there is budget for the potential installation of a pay-by-plate machine. Under services and rents, you'll see a $15,000 increase in services and rents. This is partly responsible due to we have budgeted a $35,000 cost for some contracted services to complement our parking enforcement. Under financials and transfers, we're showing a $10,000 increase, which is related to increased software costs. For a contribution to reserves, you'll see a $23,000 increase, which is intended to increase our parking reserve, which has been depleted throughout the course of COVID as a result of reduced revenues collected. Within our revenue section, you'll see a reduction of $10,000. In recent years, we have not been meeting our revenue projections since COVID. I'll say our 2023 actuals are trending up. However, they got a fair ways to go before they come back onto budget, so we've made a slight adjustment to that. Be happy to answer any questions on bylaw. And councillors have any?
Councillor Barrett and Councillor Good.
Thank you, Mr. Mayor. Is this staff complement enough?
Through you, Mr. Mayor, I think I'll ask Mr.
Sure.
Bray to reply.
Through you, Mr. Mayor. As you recall, approximately 3 years ago, we revised the way we kind of operated in bylaw. We used to have very designated positions, and we've now gone to more of a cross-trained approach. So that has helped the way that we provide services to the community. One of the things in the past, we used to have contracted services to do or offset some of the parking. That's what we've introduced in the budgets, and we feel that with bringing back that contracted services would help having our bylaw officers focus on more things such as property standards, which has always been something that needs more attention. So to answer your question, I think the way we're proposing to shift things and the introduction of contracted services, I think we're okay with the complement that we have.
Okay. How many vacant positions right now in the department, if any? I don't know.
Through you, Mr. Mayor, happy to say 0 right now.
Oh, wow. That's lovely. The contracted services, that's the department it's going to be an advantage to the department, not a disadvantage. I just want to confirm that with you.
Through you, Mr. Mayor, correct. We just like to reallocate the way that we're operating.
Okay.
And having the contracted services to focus more on the parking, and then having our staff focus more on bylaw and matters that require more attention.
Okay, great. Thank you.
Councillor Good.
Thank you, through you, Mr. Mayor. Thank you, Mr. Bray. I have a question in regards to parking, generally speaking. I know we're running a deficit as it's going forward, and obviously, the hope is that it can return to pre-COVID levels. Can I ask, in terms of the revenue that's generated from parking, can you provide kind of like a rough breakdown of where that funding comes from in terms of how much of it is actually people paying at the meter for parking, how much of it is passes that people purchase, and how much of that revenue comes from tickets, from parking tickets?
Through you, Mr. Mayor, I don't have the exact number in percentages, but it's a mix of all that. So
Yeah.
it's the meters, the machines, the violations, the monthly passes. The passes, they're starting to return back to pre-COVID normals. There was a time where they went down significantly, hence why the revenue was offset from the reserves. The other thing is we're now providing more and more options for payment. So we're seeing that there is some adjustment in the violation side of things as well, which is a positive thing because users are actually using. So we introduced the app, and you can still pay by cash if you want at the machine, the app, or directly with tap at the machine. So we're providing more options. So it is, and it's all kind of, I don't want to say new, but there's an adjustment period. So we're still adjusting to that, and then we're also trying to get back to the normals that we had before. So I think it's going to take maybe another budget cycle to see where things truly stand.
In what year did we implement the new parking system? I forget what the name of it is. I know there's the app, but
Hotspot?
Hotspot. Is it Hotspot?
I think it's Hotspot.
Yes, so through you, Mr. Mayor, we had another app. However, our service provider phased this one out, and we had to look for another app. So the one that we're currently use is the Hotspot. And that would have been a continuation of a previous app that we've had, and we've had that for about, I think we had just brought it in before COVID hit. So it's roughly about 4 years.
Okay. The basis of my question that I'm getting to, without beating around the bush, is basically, are we spending more on this system that is intended to kind of streamline parking than we're able to take in? And is this the right thing to do? What is the purpose of our parking program? And if we're in the hole every year to pay for this modern technology, is that worth it? Is that what the small business community wants? Because most of the paid parking is in and around businesses. Do you have any kind of, have you received any feedback from like the BIAs in regards to the parking programs and the changes that they want to see?
Thank you for the question, Councillor. There's a couple of elements at play. One is the team is fully cognizant that we're reestablishing a baseline post the COVID closures. The parking policy framework, that'd be city paid lots, that'd be on-street pay and display models, precede the COVID window, and had the intention to support turnover. Often there's a misconception in the municipal world that those generate revenue. The revenue that we generate from parking, and in this case, as you see, they're very low, need to be reinvested in parking as per the Municipal Act. So the team is looking at a variety of aspects. Currently, we met as late as last week to seek opportunities. So we'd be glad to take it offline, report back on the future of parking. But the fundamental remains that we're charging on street to increase turnover, which generally helps the main street. We recognize that based on usage, based on our systems cost, that there's policy and considerations that need to be had, and the team's currently conducting some of those reviews.
Thank you for that insight, and I'm glad to hear that. I know we've spoken previously about other options that exist in other municipalities, like a 2-hour parking, and people go by with chalk and do it. I've heard from a number of residents about issues that they've had with the new meters, particularly in actually entering their license plate, that it gives difficulty when plugging in those numbers, as well as with the app, that it's not appearing to register the payment that they're making. So none of us around the table actually have to pay for parking in the city, so we don't get to experience some of those just little technical flaws. And I wanted to bring that forward just so that people know that, you know, their concerns are heard. And I look forward to hearing what comes out of those evaluations. Thank you.
Yeah, we'll certainly come back with a report on parking services later in the year. Councillor McDonald.
Thank you, Mr. Mayor. I wanted to ask about property standards, and I'm wondering how many people you have who are actively engaged in property standards, and maybe it's nobody full-time. How does that work?
Through you, Mr. Mayor. As I was mentioning earlier, the way we've redistributed our workforce is now all of the officers are attending to property standards call. So we have a complement of 6 officers now, and they all are carrying a caseload. Now the caseload will vary throughout the year. It can fluctuate anywhere from 30 cases to 60, maybe more, depending on the nature of the calls that come in. And as you know, property standards, there's a time element. So it's not like, you know, a case comes in and the officer can deal with it, you know, within a couple of days. If an order is issued, it does take a period of time, depending on the nature of the call. But by minimum standards is you're looking at about 19 days before we go to the next step. So they do take time, but currently we do have the 6 officers that are available to handle those calls.
Now, at one point, I don't think it was in budget cycle last year, but at some point last year, you did give us kind of a report card on how many calls or cases you had looked at, and I think you showed how long it took to wrap them up as well. Do you intend to do something like that for us again?
Through you, Mr. Mayor. Yes, we can continue to do that in 2024 to bring those reports back. I think we were doing it quarterly.
Okay, great.
Yep.
It's great service to us. And I just want to tell you, I had a fabulous compliment paid to property standards about 3 days ago, but I'll give you the name and address after. Apparently your officers even came back without being called, just to see if something had been done and that sort of thing. So I think that kind of attention to an individual in need was certainly very appreciated in that case, and I'd like to publicize it.
That's very good to hear. It's often the opposite we hear.
I'm sure.
But thank you for sharing that.
Yeah.
Further questions or comments? Councillor McIntosh?
Yeah, I've often, nobody's beating me at my door down asking this question, but every now and then somebody asks about the free parking. Brockville has free parking. If I understand it right, the merchants pay for that, not the municipality? Like, there's a formula they use where the free parking is, the BIAs give the city so much money a year to fund the free parking?
Through you, Mr. Mayor, are you referring to the program that we kind of offer during the month of December? Or?
Yeah, but in Brockville, it's all the time. You can park downtown Brockville. You never have to put any money in the meter. And I'm told, though, it comes out of the tax base. The BIA pays for that. Are you aware of that program? Or?
I'm not aware.
Yeah.
We can reach out to Brockville
Yeah,
and try to get some information.
I think Elaine has something.
Councillor McDonald?
Actually, I was on a parking committee years ago when we struck one, and our first thought was, let's do what Brockville is doing. So we investigated, and sure enough, it is the DBIA. And I think the price tag then, and it was at least 10 years ago, was that each merchant along King Street contributed $35,000 a year to to maintain that spot, because it was great for business. And we, of course, were in touch with the merchants downtown, and nobody bit.
Further questions, comments? Thank you.
We'll proceed on then to our building services operating budget on page 146. Again, some of the variances for salaries and benefits, you'll see a $273,000 increase. This is largely related to the staff from the bylaw department that's been transferred to building services as well. We are proposing 2 new positions, a zoning technician as well as an additional building official. The purpose of the zoning technician will be to do zoning compliance reviews for building permits that at the moment are, that is a task that falls to the planning division. And then the building official position, this position, the intention is to have this individual focus on historical open building permits that have yet to be closed. And so we have a significant backlog of open building permits, and that creates a bit of a liability for the city. And so this individual would go through those, engage the applicants, and seek to close out those files. Under services and, or I should say, purchase of goods, marginal increase of $3,000. Under services and rents, we're showing a $61,000 increase. This is largely related to a $65,000 one-time expense budgeted for the digitization of historical building permits, which will help clear up sort of space within the department, as well as make it more efficient to access that information. Under our financials and transfers, we're showing a reduction of $25,000. This is related to a project that was underway last year as a software project to implement a cashier module in our CityView software. Under revenue, we are estimating an increase in revenue of $354,000. Almost $200,000 of that is a contribution of reserves, which is intended to fund the 2 new positions, the zoning technician and the additional building official. The balance of that increase is anticipated building permit fee revenue.
Councillor McIntosh?
I had a call from friend of mine I went to school with, and he's one of the major contractor builders in town here. And he wasn't complaining, he just wanted me to be aware of it, that the building permit fee, he said, went up $10,000, and he was now paying $30,000 a year to build a house. Am I reading that right?
Through you, Mr. Mayor. When we did our building permit fee study back in 2018 or 19, I believe, we included a component to index our permit fees, and this is kind of a trend that most municipalities are doing now. What was happening historically is our permit study or fee study was done, and these fees would stay stagnant for years and years, and then when we do a study, we would find, and this is not unique to Cornwall, but you would find that the permits would jump significantly. So to kind of offset that shock in price, if you will, we've elected, as most municipalities have, to index our fees. Very similar to the indexing that we do with our development charges. It's based on the CIP. The numbers have been a little higher than what would have been anticipated with the last couple of indexings that have occurred. So they, I'd have to check the exact numbers, but 30,000, it depends on what type of permit you're looking at. But for a house, if you're including development charges, that's probably included in that as well.
Okay. Again, he wasn't upset, he wasn't yelling, but he was just saying that he passes that cost on. He says, like you normally do, he doesn't eat it. So he says it raises the price of a house by 10,000. So, you know, and the whole market is affected by that. So he was just pointing that out to me that, you know, he passed that on to the buyer and increased of course, the tax revenue increases too. But I thought it was kind of high. He said 30,000 per house, but he builds a lot of custom houses.
Councillor McDonald?
Thank you, Mr. Mayor. So I'm just curious to know how the liability works. I know I got a permit to do something to my fence, and I actually got some money back when I, you know, put it up for inspection, saying it was finished and that sort of thing. So if somebody leaves a permit open, but there's liability on us, so not just lost to them, how does that work?
Through you, Mr. Mayor. So the way the Building Code Act and the regulations actually spell it out, the responsibility for the permit holder, or the responsibility is for the permit holder to call for their inspections, and that's, you know, from the early stages, whether it's footings, foundations, all the way to occupancy and final. That's what the regulations say. However, there's recent case law, I believe it's 2022, that there's been a significant change in the landscape now, where through this case law, the municipality, and I wish Councillor Sabourin was here because he would appreciate the duty of care is the language, that the legal language. So the municipality has a duty of care that's been highlighted through this case law for attending to these outstanding files. Again, this is not a unique problem to Cornwall. Historical permits that are not closed is across the province. Everyone is carrying a certain load. So this recent case law was a bit of an eye-opener for municipalities around to start focusing on closing those files. So one of the items that we did when we introduced our new fees back in 2018 was to introduce deposits on permits. So much as you mentioned with the fence, there's an incentive, if you will, to call in for your final. And we have seen that has been successful, but we need to do more. So that's what this position will focus on, working on closing some of those files.
Councillor Bennett.
Thank you, Mr. Mayor. Through you, in the you were just talking about you're going to withdraw from reserves $108,000 to help offset the cost of the 2 new employees. How do we plan on paying for that going forward? Are we hoping that our revenues increase in other areas to offset that, or are we going to be in for a $200,000 shock next year?
Through you, Mr. Mayor, through time, I believe with our indexing, we're going to kind of catch up to that. So I think it will get absorbed into the overall cost. Will there be a small amount next year? Possibly. We'll see when it comes to budget time. But it also depends on, you know, we try to forecast conservatively on what projects we see that are forthcoming. Yep. You know, depending from one year or not, there may be a surplus, but sometimes there's deficit, and that's what the intention of that reserve is, but this is what we're proposing for this year.
Okay, thank you.
Further questions, comments? Councilor Gardner?
You people are going to speed up the process. Is that what you're saying? For permits?
Through you, Mr. Mayor. So one of the positions for looking at the unclosed historical files won't necessarily affect the new permits. We're going to be focusing on the historical permits. The second position, which will be a zoning technician, will help to review the permits and the site plans that are related to permits. It should help in the overall efficiency in the department. Yeah, so it will help.
And the reason I ask is because I have a neighbor, actually two of them, who have permits on hold. The plans are there, the engineering plans are all there, permits are ready to go, but he's not getting it. So now the winter's come, so he wants to build a carport. And he's been waiting almost 7 months for the permit. So I don't know if there's a problem with it, or whether or not this is going to speed it up. Because I get it from him on the road when I'm walking. I get it from him in the grocery store when I'm in there. That same person comes after me over the same permit. So I hope it increases the speed.
Further questions? Thank you.
Thank you, Council.
Thank you. Next up will be our Recreation Services Department. We have Miss Lori Gibo, our Manager of Recreation, will join me. So the variances within this department, you'll see for salaries and benefits, we're showing a $186,000 increase. This is partly in response to incremental and contractual obligations that are due to our staff, but as well, there has been an increase in the minimum wage for 2024, which is resulting in $1 an hour increase. The Recreation Department has a large complement of summer students that we rely on to deliver our recreation programs, and so a substantial portion of that increase is a result of that minimum wage increase. For purchase of goods, you'll see a marginal increase of $1,800. For services and rents, you'll see we're showing an increase of $137,000. This is largely due to the increased cost of about $127,000 for our contracted security services that we use at our recreation facilities. A recent tender in 2023, we saw a substantial increase in the tender results that is responsible for that increase. As well, within that $137,000 is we're estimating a $20,000 increase to the lease agreement for Altsville Theatre. And then for our financials and transfers, you'll see a $170,000 increase to financials and transfers. This is largely related to a reallocation of our contributions to the $155,000 to the Historical Society. This previously was in the Facility Department's budget. It's been transferred to Recreation Services, so you'll see a corresponding decrease in our facilities budget. And under revenue, you'll see we've estimated a $195,000 increase to our revenue, which is broken up amongst a number of different items. We're forecasting an increase in our general arena rent, our room rentals, as well as an increase in donations at the Klein House. And furthermore, our recreation fees have increased by 1.8%, which is contributing to that increased revenue as well. Happy to answer any questions.
Councilor Bear.
Just a quick question. How long is the contract with this private donor for the Klein House?
Through you, Mr. Mayor, it was a 3-year originally a 3-year, I guess, donation. I believe we might be entering year 3, I think.
This year's year 2. So our next budget that we'll be preparing will be the final year at this point.
So 2025 is the final
Yeah.
year. Okay, there could be some opportunities to negotiate maybe with this donor and an extension. Has there been, I see we're still like 2 years, technically, year or so away. Has there been conversations internally of how to keep this managed by the city sustainably without potentially a donation?
That is the intention, yes, but we're just waiting to get through this budget process to be able to move on from there.
Okay, so let's get this budget
Through you, Mr.
process
Mayor, we
done.
have had some conversations about starting to try and wean ourselves off of this generous donation
Okay.
from this individual, whether it's budgeting a certain amount a year so that over the course of a few years, it becomes somewhat less reliant on that donation and the city incrementally
I like
fund
that
it.
idea. Yeah, because it's such a great addition to all of the support to the arts we are providing, so it'd be a shame to lose it. So glad to know that there's a sort of an incremental plan in place for the future. Thank you.
Councillor Tupel?
Thanks, Mr. Mayor. Through you. So when you briefly described the increase or the huge increase into the security contract, how long is that contract for?
Through you, Mr. Mayor, it's a 3-year contract.
Okay, and what was the total increase from the previous? Is that the change in that line? Is that the increase all to that security?
Through you, Mr. Mayor, it was, $127,000 is the increase for our security costs.
And what, that $127,000 increase to what we were already paying?
That's correct.
And so what would the total be for that?
I don't have the exact numbers, sorry, through you, Mr. Mayor. I believe over the 3 years, it was around 950,000.
And what does that security provide? The Benson Center and the Civic Complex?
Through you, Mr. Mayor, the Benson Civic Complex and also the Aquatic Center.
As well, but we do use some contracted security at Marina 200
Yep.
in the evenings.
And that would be event security as well.
So that doesn't fall under the marinas? That security doesn't fall under the marina in this line?
The marina budget is rolled up within recreation
Yeah.
services.
So that expense is in this budget?
In this budget. In that 127, it's in there as well.
So roughly then about $300,000 a year in security?
I believe that's what it was, yes, through you, Mr. Mayor.
And sorry, one more question. Do you know how many hours that consists of?
Through you, Mr. Mayor, I would have to take a look and see exactly what it was, but I believe it was somewhere around 4,500 hours for the Civic Complex. Roughly the same for the Benson Center. And I'd have to definitely take a look at that to give you exact numbers.
Yeah, if you wouldn't mind,
Yeah,
I would
sure.
appreciate those numbers. Thank you, Mr. Mayor.
Councillor, if I if I might add, during my recent the last few months, we have seen the tender result with the security elements, and as Lori described, for the recreation purposes, but maybe turn it over to Tracy, because there are other implications of that tender and security, and I would give an example for Parisian Manor for our winter housing plan, where there is security. In this case, we were able to work through a partnership with United Way, but for any provider or any area where we would require security agents of sort, that tender price is applied. So yes, core to recreation services, but obviously those prices those increase in prices are reflected for a number of areas that might require security. So I see Tracy right behind your eyes there, and I wonder if she'd had additional comments.
Through you, Mr. Mayor, I think what we'll do is we'll provide that tender report to you, Councillor, and some further information of the change that we've seen in pricing. And I think that would answer your questions.
Just to
Councillor
follow up,
Dupel, yeah.
Mr. Mayor, through you to the CAO. So when you talk about that it could be used in different, and I'm sure we'll see it in the report, but I'm assuming that the other budgets that are using that security, it's reallocated, the expense is reallocated to those departments and not all to.
Most of the areas that would likely be required would be within recreation, but yes, if there would be a need for housing, housing would identify a source of funds for those services.
Okay, thank you. And that'll be outlined in the report?
I'm not sure as we drafted the tender, I think it's like almost like a per unit hourly rate and services that are included within the tender, but I stand to be corrected by Ms. Bailey.
Thank you. Through you, Mr. Mayor. Yes, it's a plus or minus so many hours at our different facilities. And then events, I believe that we have other security company for housing. We go out for pricing, and it's based on a procurement in that manner. So we'll provide that to you, Councillor.
Okay, and I'm assuming there's a user fee to anyone that's using the complex. The Cornwall Colts pay for security. Everybody pays for.
Through you, Mr. Mayor, yes, if there is an event that requires additional security, then that is done through the arena rental and a reconciliation in which that organizer would reimburse the city as part of with their rental contract for any additional security costs.
Okay, thank you.
Okay, I have a speakers list. Councillor McDonald, you're next.
Thank you, Mr. Mayor. So I'd like to go back to the increase in minimum wage. That's great news, and I'm hoping this means that we're going to have enough lifeguards this summer to operate more fully. Have you got any?
So through you, Mr. Mayor, just in speaking with our aquatic supervisor today, I got a rough number of how many lifeguards we have on staff right now, and I am very pleased to say that our numbers are coming up, and we have roughly 54 part-time and 3 full-time lifeguards. So that is very good news. If we keep those numbers through the summer, as you know, some of the pools in the summer in our outlying areas open as well as Calypso, and we do tend to have some of those students go to those municipalities. But we are very hopeful that we will be at full complement this summer.
Good. And are we paying minimum, or are we paying a little bit more?
Through you, Mr. Mayor. So the lifeguard rates are anywhere between $18 and $21 an hour. And then also with our summer students, our summer playground program, our marina attendants, those are between $17 and $19 an hour.
Okay, and obviously you feel that's competitive?
Through you, Mr. Mayor. There is a lot of cost associated to becoming a lifeguard and an instructor.
Absolutely.
And a lot of time spent, anytime from the ages of 14 to 16 years of age. And not only do they have to certify, but they have to recertify their qualifications every 2 years. So it can be a costly position to hold. We are looking at doing more internal type recertifications to help minimize the cost to our staffing. And that has been a little bit of an incentive there as well.
Okay. So right now, do lifeguards in training have to travel to certify?
Through you, Mr. Mayor, thankfully not at this time.
Okay.
We still do have a couple of national lifeguard instructors on staff. Very few instructor trainers, but we do have somebody that we do contract out to come and run some of those courses for us.
Okay. And then my other question has to do with the fees. You say you've raised them by 1.8%, and I think that's fair. But I understand that you do subsidize some children, and I'm just wondering what kind of a pickup you get on that and how you advertise it. Like, are people aware, and how do they access that service if they are aware?
Through you, Mr. Mayor, thank you for that question. We're just starting to discuss this at our Recreation Parks Advisory Committee. We do have funding. At this time, it's called affordable funding. We are trying to look at branding that a little bit better so that as a fair subsidy, which would be fee assistance in recreation. So we're trying to brand it a little bit better. It is, for those that qualify under the low income cutoff, there is a subsidy of 75% that is covered by the city, and the client, the participant, would pay 25% of the actual registration cost. How do we market this? It is a lot by word of mouth. It is on our website, but it is hard to find. I've actually just looked at the website and updated that, and are looking at having an online application process. So that is in the works, and we hope to be able to market that a little bit better once we bring another fee policy to council.
Very good. So at some point, could you tell me just what the uptake is, like how many?
Sure. Through you, Mr. Mayor, I'm going to try to remember my numbers here because I just did a presentation about it, but I believe we had around $20,000 in subsidy that was allocated. That was 108 participants. And out of those 108 participants, I believe that there were only 11 or 13 that maxed out at their $200 maximum. And then there were approximately 33 people that didn't touch their subsidy whatsoever. So we're going to do a little bit more investigating as well as to why the subsidy wasn't used. It could have been a change in financial situation that they were able to pay the registration fees then.
I would hate to think that it could be because they weren't aware of it, so I'm glad to see that you're on it.
Yes, and through you, Mr. Mayor, anybody that was allocated that subsidy would have had to have applied, so they would have been aware of that situation.
Yes, strange. Okay. Thank you.
You're welcome.
Okay, Councillor Good next.
Thank you. Through you, Mr. Mayor. I'm glad that Councillor McDonald brought that up because that was one of the very first items that was actually discussed in our first meeting as a Recreation and Parks Advisory Committee. So under review and hopeful to be able to find something that really works for people and that is easily accessible. I have a few questions not related to that. So Marina 200 is included under what we allocate here for recreation. Can someone provide more information about that arrangement? So we provide attendance, 2 attendants, I believe you said, 1.5. And we provide security, and we also maintain the structures themselves. But are we paying another entity, or?
Through you, Mr. Mayor, no, there used to be historically there was an arrangement in which we would contract out an operator, but I'm going to say it's been a few years now where we were unsuccessful at finding a new operator, and so we have taken the operation in-house. So we collect the revenue from it, and we hire the staff. It's completely a city-run and delivered service.
Okay, and I was just in previous conversations with my colleague talking about the marina. I think it's the Grace Creek Marina that's run through the RRCA, and that they're quite successful in their profitability of the marina. Are we able to look at a cost recovery model that's going to make sure that it's sustainable?
Through you, Mr. Mayor, the marina operation itself does produce a surplus. It's the facility upgrades. The facility was constructed in the 80s, I believe, through federal dollars. And so now as the facility has aged and requires renewal, you'll see in the bottom of page 149, you'll see a marina activity, which is showing basically a $43,000 surplus, in which I understand it's the operation of it. It's the capital investment required in those facilities that is what puts it in a deficit.
Okay, just because in the presentation that we have about non-core, non-mandatory budgeted services, it's listed as 103, almost 104,000.
Yes, I could be wrong, but I believe that is that is a summary of both the facility investment that needs to go into the marina, as well as the operating. So that is a net cost to the city, but that includes, as you'll see as we get into facilities, there is a capital works to upgrade dock structures there.
Yeah, I think it's like 75,000.
There's $75,000 there, and then there's money within the operating budget as well.
To do just minor repairs?
To
kind
do,
of thing?
yes, that's
Okay.
right, yeah.
Okay, thank you for your clarification on that. I'm also wondering, I see that the Historical Society was brought into the recreation portfolio. Can you kind of explain the relationship there and how that works as well?
I'll say through you, Mr. Mayor, the Recreation Department has, I'll say, it's a bit of a historical, I guess, partnership or agreement in which the city has provided fund. You got it, yeah. Which the city has provided funding to that organization. We do have a limited involvement as to how they operate it. It's really, I'll say, from a bit of an accounting perspective, as it's seen that it seemed to be more of a recreation activity, as opposed to, I think originally it was in the facility, as a line item in the facilities budget, because, you know, the building itself is ours. But in fact, this is an amount that's provided to the Historical Society to operate the museum and run their organization.
Okay, my assumption is that they have like a $1 rent kind of thing or something to that effect?
It's through you, Mr. Mayor, I believe we do not have an agreement in which they pay anything to use the building. The building is ours, we maintain it. And this funding is to allow them to operate it as a museum and operate or run their programs and activities.
Perfect. My last question has to do with, I guess it's kind of a few things, but Civic Complex bathrooms specifically. I know, often we have events down at Lamoureux Park, and sometimes it's open to the public, sometimes it's not. I know there's a mention of the security guards in here. I just want to get more clarity around kind of what's the criteria? How is that determination made for when it's open or when it's not? Because I know the bandshell washrooms are typically closed off to the public, and unless you're going to go by the splash pad, it's kind of the closest place to go.
Through you, Mr. Mayor, maybe Lori can correct me if I'm wrong. With our the security at the Civic Complex is a challenge. It is a very large building, and when people get in after hours, they can get into all kinds of different areas. Particularly during COVID, sort of an effort was made to sort of restrict access at the main front entrance there, and we provided porta potties outside, access to a accessible washroom in the aquatic center as well, and then, as you mentioned, at the splash pad, there's accessible washrooms there as well. Typically, if there is a major event going on in Lamoureux Park, such as Ribfest, Canada Day, any of the signature events, we do recognize there is an increased volume of people accessing the park. We do have security staff on and open that main concourse so that those washrooms are accessible. But I'll say on a general, any given weekday where there is little activity, what we have been doing is locking the front doors of the complex when the offices close. However, the public can access the Civic Complex arena through the aquatic center, where there's washrooms there and front counter staff there as well. And so it just provides a little bit better eyes on the people that are coming in and out of the building, and just from a general public safety and security perspective.
Perfect. I appreciate that. Is there a sign on the door that indicates to people that they can get in through the aquatic center?
Yeah, through you, Mr. Mayor, there is. Yes.
Okay. All right, I will leave it there. Thank you so much. Oh, wait, I have one more. Can I just very quickly? The bathrooms by the splash pad, I know we had a conversation, I think last year, and I know it's not in the capital budget, but is there any plans to do any kind of cleaning up, we'll call it, painting, just some minor replacements of the equipment there?
Through you, Mr. Mayor, we certainly can look with operational dollars
Yeah.
to paint or do any needed maintenance that is. We have done some work within there recently to allow the washrooms to be open throughout the winter season. But we do have some struggles there as well with vandalism due to the fact that there is no staff presence there. And so it can be a bit of a challenge in trying to maintain the condition of it into, at the desired level that we would like to offer the public.
Well, it's definitely an appreciated asset in the city, so thank you for that.
Councillor Hollingsworth and Councillor McDonald.
Thank you, Your Worship. A couple of quick questions. Our rates at the marina, just for the record, Laurie Williams not available this year. He's in Australia, so you can't call him anymore. I'm joking, of course. Our rates at the marina to rent slips, do we know if they're comparable to Grace Creek? Do we know, are we in line with what Grace Creek charges to rent slips?
So through you, Mr. Mayor, just this year, we did take a look at all of the slips in our area, including Grays Creek, Prescott, Gananoque, Kingston, and Chrysler. Yes, Chrysler. And we did increase our rates accordingly. I believe we are a little bit higher than Grays Creek.
Okay. And when we establish our prices for gas, how do we determine that? Like, are we competitive?
Through you, Mr. Mayor, yes, we are competitive. Can't give away all of the secrets, Mr. Hollingsworth.
I guess it's a dog eat dog. And the last question with regards, all joking aside with lifeguards, historically, the last few years, were we understaffed in terms of pools to try to keep them open, in the sense that typically, if I'm not mistaken, it used to be 5, right? So you had a supervisor, an assistant supervisor, and 3 kind of lifeguards rotating through. Have we, in the past years, did we kind of have to finagle that a little bit, or were we able to maintain that number?
So through you, Mr. Mayor, we did have to make adjustments to our schedule and to our programming and to our bather loads as well, because we did not have a full staffing complement. We would typically have a supervisor and +5. So like you said, an assistant supervisor, and we would have 4 lifeguards. In the last couple of years, so typically we would hire 36 for the summer, and the last couple of years we've been between 25 and 28.
Right. And have we ever looked at, as you already expressed, having paid a few bucks for my kids to go through the program? They're off the hook now, long past all that. But have we ever looked at trying to compensate, at least for the last 2 courses that you need to become a lifeguard? What is it, NLS, and there's 1 and 2, or however it works, I can't remember. But have we looked at compensating that part of the training? Like, even if I have to go to Ottawa, I know some people, friends of mine, who kids are just about ready to get into the program. Have we looked at saying, okay, if you have to go to Ottawa, if we can't do it in-house, are we prepared to try to compensate them to get them to stay here and be lifeguards in Cornwall? Have we considered anything along those lines?
So through you, Mr. Mayor, it's always a challenge in the summertime when you have so many other outlying municipalities that offer pool programs as well. We are stealing from each other, it seems, which can be difficult. So, we have increased our wages over the last couple of years to try to compensate with that. And with regards to training, we are trying to offer more in-house training with regards to the lifeguard program and the instructor program. There are some subsidies available for the user fee component, but through those charges as well, some of those charges are directly to the Life Saving Society for certification, to the instructor, and to for books and manuals.
Right.
So those we do not subsidize, but we can subsidize the user fee portion itself, which can help somewhat.
Okay, thank you.
You're welcome.
Thank you, Your Worship.
Councillor McDonald.
Thank you, Mr. Mayor. Just a quick follow-up to Councillor Good's question about the washrooms. I know that there's no comparison between a washroom in the civic complex and a porta potty, but when we have big events, don't we require the people putting it on to bring in X number of porta potties? We do.
Through you, Mr. Mayor, yes, we do. For those big events, they do have porta potties that are available that they bring in.
Thank you.
Mr. Seo?
Mr. Mayor, I think you saw me go and see the finance team just to get a bit of clarification. So I know there were a few questions there by Councillor Good, and I'd ask for Ms. Bailey to give the context, particularly relating to the marina and the historical society. Because I think what we're presenting, Councillor, is within year. What is complicated to capture, and I appreciate the team's efforts, is capital pressure and source of fund for capital pressure relating to both of those areas. So just for sake of transparency on the matter, I'd ask Ms. Bailey to explain source of funds and risk on capital for both of those.
So through you, Mr. Mayor, further to Mr. Fothrop's commentary, the marina is, it does make money for programming, so about $28,000. But then there are costs associated with the marina for operation, and that's what you'd seen on your screen, operating at a net cost, to Mr. Fothrop's point, of $104,000. The docks at the marina for $75,000, that's being funded from the Canada Community Building Fund. So it's not included in that amount. It's net zero for capital for the 2024 budget. The museum, we transfer money to the Historical Society, and that's the $155,000. And then we have responsibility to keep up the museum at a cost to the tax base, and that's just under $33,000.
Councillor McDonald?
Thank you, Mr. Mayor. I heard, I think, a year or so ago that the museum was going to build an era-sensitive porch. And did they ever?
Through you, Mr. Mayor, yes, they did. We provided some assistance with that as well, but that they have added a porch onto the front of the museum. It is still, I believe they are still working to try and find someone to do, I think they, West Libby called it some gingerbreading kind of trim that was to be historically accurate to the original porch on the Woodhouse Museum.
Okay.
Yes.
I went to the museum the other day, and I couldn't get in the front door. Like, first of all, there was snow, so, and I wondered what happened to the grand porch that, so, okay, thanks.
Further questions, comments? Councillor McIntosh and Councillor Gardner?
Yeah, just to comment on the Grays Creek versus our marina, and I'm on the Raisin Region Board, and they reported recently a big profit there. But in a strange way, we're helping because we give them $560,000 a year, which they use some of that money for capital upgrades, so it's... Anyway, the hockey rentals, OHA play a big role in this.
Through you, Mr. Mayor, yes, the OHA partnership with the city is, in our view, quite a good one, in that the ice that they use is predominantly during the weekdays, during the daytime, which if it weren't for OHA's use, they would that ice time would largely sit unused. So it is a nice
So do
partnership.
they get them, I mean, obviously they're your best customers, so you give them a better rate.
Through you, Mr. Mayor, anyone who rents during the daytime, we have a non-prime time fee, which allows them, I believe it's 30% subsidy. Now, OHA has a individual special agreement that's approved by council, which I believe gives them a 37.5% subsidy on that rate. So it's an additional 7.5% subsidy above what the general public would access.
If I operate a for-profit, or I operate a hockey team that charges admission to get in, do they get what rate would they play? Would they get minor hockey rates, or?
Through you, Mr. Mayor, it all depends on the group. We do have a hockey club that does have a specific agreement with the city that grants them a subsidy. And I'll say all our minor sports access a 40% subsidy as well.
Would that hockey club get a special rate when they run hockey schools?
Through you, Mr. Mayor, they get us that rate for all of their ice rentals.
Do we have any outstanding bills?
Through Mr. Mayor, yes, we do have a number of clients that do carry outstanding bills. I'll say many of our clients, whether it be minor sports or associations or private groups that rent continuously throughout the season, typically do always have some balance or another.
I'm just wondering, I'm not trying to get into the weeds on this one, but how long would we let somebody go? Say they owed us X number of dollars. Do they pay at the end of the year, or do we carry over and over and over?
Through you, Mr. Mayor, we do typically invoice, I believe, monthly, and follow up with those groups to collect. If a client is not paying within a regular, meeting the payment expectations, we do try and work with those to try and work out specific payment agreements to get them back in good standing. We did have a number of clients throughout during COVID that had that struggle, saw their outstanding amounts owed climb, and we have been working with those clients to try and get those out. Unfortunately, no, we do not charge interest to our clients for their amounts owing.
Okay.
Councilor Gardner?
Thank you, Mr. Mayor. Unfortunately, I left another pad at home. There's a patio at the complex for $300,000 to replace the. Is that a priority item? Do you know what part of the book it's in? I couldn't find it.
Through you, Mr. Mayor, I believe you might be referring to a capital project in our facilities section, which will be coming up shortly. If it's the one I'm thinking of, I believe it's budgeted at $160,000, and it's immediately across from the main entrance on the north side of New Zealand Way.
Okay. I just wanted an answer for that. I'm looking at possibly delaying those two pieces at $300,000 and $160,000. But if it's if the workers are going to be there, let's get it done, I guess.
Councilor McDonald?
Thank you, Mr. Mayor. So I think we're probably winding down rec services, so I want to ask you about what's free. I know you can skate at the Benson Center sometimes. How often? And I hope that's still going on. And when can you swim for free?
Through you, Mr. Mayor. So there is a seniors public skate. I want to say it's Monday and Wednesdays from, I don't want to say the wrong time, but I'm
That's
thinking
okay.
It's the morning.
it is the morning. You can always check on our website. That information is there, and through our registration software system as well. You can register online, even though it's free. There is still limited amount of space as well. So I believe it's 9:30 to 10:30 or 9:30 to 11.
Okay, well, what I saw once when I was there were kids, so you've got a kids program too, and how often is that?
Through you, Mr. Mayor. So we've just restarted our parent taught program. So that's usually once a week.
Okay, like I saw kids about, say, in the 5 to 10-year-old range. A lot of them with those plastic supports that kids use when they're.
Through you, Mr. Mayor, that would be that'd be our public skating.
Oh, okay,
Yeah.
so
Yeah,
there is
and
that,
that's $2 for the hour. Yeah.
and that's once a week?
We try to program it more. It just depends where we have open slots in our programming. So wherever we have an open slot, we try to program either a public skate or a stick and puck, which is very popular as well.
And what about swimming?
Swimming is not typically free. There's usually a charge to that, but there are oftentimes community organizations that do sponsor them. And for the upcoming Family Day weekend, there are some sponsored swims there that will be free to charge for the community.
Okay, glad to hear it, because I asked a class once what you could do in Cornwall for free, and some kids said you can get free food at Farm Boy sometimes. And that was all. Like, nobody mentioned. The little samples, you know, when you walk in. Oh, and thanks for the free walking opportunities at the complex. That's a wonderful service.
That
It's
is-
the gym for so many people in town.
Through you, Mr. Mayor, we also offer that free walking at the Benson Center too, from 7 in the morning till 1 p.m. or any time the field house is not being used.
Further questions?
We do have one capital project under the Recreation Department, the waterfront plan on page 151. Within this project, there are 4 elements. We are budgeting $500,000 for the construction dollars to establish a beach in Gaineau Park. We are budgeting $30,000 to develop a bike share strategy. We're budgeting $50,000 to develop a public art strategy and master plan, and budgeting $20,000 to complete a study for an off-leash dog park within the city of Cornwall.
Councillor McIntosh.
I just want to go over my favorite subject here with Jamie. The bike share strategy, is that a study?
Through you, Mr. Mayor, this was a recommendation within the our waterfront plan that was recommending that we seek to develop a strategy, or some communities do have, whether it's a drop bike kind of program in which anybody could kind of pick up a bike and go. We did start through our tourism department and in conjunction with Marina 200, a bike rental program in which the public can come and rent bicycles along the waterfront. We have also made some attempts in the past with some of our local bike shops to try and partner and introduce bike rentals within the park as well, with some, I'll say, limited interest, I guess.
I guess what I'm trying to say is that, are we giving somebody $30,000 to tell us how to set up a bike rental operation?
Through you, Mr. Mayor, that very well could be the
Boy, I want to get in this
intent.
business after. And same with the art strategy and the off-leash dog park, that's $20,000 for somebody to, you know, this is like the 19th study we've done on this thing.
I think through you, Mr. Mayor, I think part of for off-leash dog parks can be a bit controversial, particularly where you site them. They can be noisy. It's not necessarily a park amenity you might want to install within vicinity of someone's home. You know, might be subject to listening to barking dogs most of the summer. As well, we've in some of the public engagement through the waterfront development of the waterfront plan and a recreation master plan, there's certainly some a wide range of views as to where an appropriate location to locate a dog park would be. Some are adamant that it be located central within the city, within walking distance to the population, and want to see it on waterfront park space in Lamreux Park. Others have opinions that it really could be located anywhere in the city, somewhere like Gaineau Park where there's a surplus of space.
Or Hydro Park.
Could accommodate it. Or, and currently there is an informal one located at the OPG dam as well, that OPG is very generous to allow
Having
that
said
to
that,
continue.
the money that's being spent on the beach, proposed beach, what's that, is that another study or?
Through you, Mr. Mayor, actually this is a two-part project. We had previously budgeted funds to do design work to reconfigure the boat launch at Gaineau Park, as well as come up with a design for the beach. Last year, we had budgeted funds to do the boat launch work, the construction work.
That's a new launch too, isn't it?
It would be a big part of it would be a reconfiguration of the road network to access the launch.
Yeah.
Currently, what we've identified as a concern is there's quite a bit of people that access that park space and use the picnic within the sort of grassed area, but it's surrounded by gravel roads for vehicles pulling boat trailers to launch their vehicle, and as boats wait to launch their, vehicles wait to launch their boats, they tend to be queued alongside the shoreline on the east side of that point, and we see sort of families picnicking in the grass and their kids running to access the water in between the queued vehicles waiting to launch their vehicles. So we'd like to reconfigure that roadway to separate the boat launching use from the public accessing the water.
It's good, you know, nobody around this table knows that area better than I. Launch there all the time. And that area, I've looked at that beach area. I'm going like, man, it's going to be a challenge. It really is. It's going to be a very small beach, as beaches go. You would agree with me. It's not a huge beach. And it was once a quarry back before the Seaway days. And so, and one Sunday, there were 32 trailers parked where the beach is going to be. And I had to go park way over in the parking lot. It's very popular in the summer for boaters because it's free. Well, it was. So anyway, I really have my doubts about this putting the beach there, but you know, I'll go along with it. But you know, there's all kinds of challenges up there. Security was going to be a major problem. So anyway, that's about the only place in town you could put a beach if you want one. So.
Councillor Hollingsworth?
Thank you, Your Worship. I can tell you boat launching is a terrifying business at the best of times. That being said, having launched a few boats in my time, we looked at the boat launch beside the RAF down. Have we ever looked at trying to make that safer, or is it just good luck? Because having honestly, all joking aside, it is terrifying. People are behind you and zigzagging all over it. It is kind of a free-for-all at times.
Through you, Mr. Mayor, yes. We have identified that there is, particularly, you're right, launching boats is a bit precarious activity, backing up trailers and with boats and poor sight lines. And in particular that location, what is draws staff concern is the location of our bike path that crosses right at the
right where you're
across
backing
the
up.
launch. And
Terrifying.
so we have had discussions and about possibly rerouting that bike path around the north side of the parking area that's adjacent to the just north of the boat launch, and then having it cross the roadway that comes down from the RCAF wing and keep that bike path on the north side of the boat trailer parking and as well as the public parking area, and instead of having it come down and cross the boat launch itself.
Right. I mean, the regrettable component is that people on their bikes or walking don't understand that when you're backing your boat in, you literally have an awful lot of sight lines to try to keep track of at the best of times. They don't stop because they don't understand. It's a tricky kind of proposition. The other question I wanted to ask, so if you look on that page 151, we have $100,000 in consultants for those three components. Is there no way we can do any of these in-house? Like, it just seems, I mean, it seems like a dog park doesn't strike me as an overly complicated concept, and yet we're going to pay somebody 20 grand to look at this. Could we not have some students do some number crunching or something to that effect?
Through you, Mr. Mayor, we would recommend, I mean, what's nice about retaining a consultant is you're retaining someone who's got a field of expertise in it, although it might seem like a rather simple concept, fence in an area and find a proper location for it. In fact, off-leash dog parks can be quite litigious, and with issues of people getting bit, other dogs getting bit, and so there are some industry practices out there that, again, without having a dog park in our community, our staff have, it's not an experience that we've lived through and had lessons learned. And so by retaining a consultant to come up with a conceptual design that conforms with good industry practice as well, a part of this will be the public consultation process in which we would put out a number of conceptual designs out for the public to see what particularly locations they like and see if there are amenities missing, you know, whether people want water sources available for to be able to water their dogs, or shade structures installed. Those types of things are what we're hoping that a consultant will incorporate into a conceptual design.
Fair enough. Thank you, Your Worship.
Councillor Good?
Thank you, through you, Mr. Mayor. I echo some of the same concerns in that it feels like study. And, you know, while I recognize the value of good planning, sometimes you just have to do. I'm really excited about the beach at Gaindon Park. That feels like something that's going to be appreciated by many of our residents, because we either basically have to go east or west to access a beach. Have you done any kind of like, is this actually to create the beach, just so that I understand it, developing a beach zone, so that we're going to make a beach zone?
Through Mr. Mayor, yes, this would be the construction dollars to construct that beach. We had a previous capital project that was approved to advance the design work for the beach. So this would be the construction dollars.
So in that conceptual design that came out, did they provide any kind of fee structure or something to that effect to ensure sustainability and that we have money to put back into the beach as it needs it?
Through you, Mr. Mayor, that design exercise has not yet been completed.
Oh.
And so we do not have that information. I think at the moment, the thought is that the beach would be it would not be a staffed beach, and so there would not be, it would not be a charge, our expectation not be a charge to use it. Very similar to, I would say, what's it called, just west of there, Lakeview Heights, across from the Lakeview Heights subdivision in South Stormont. They have a community beach that's free to access, that has public washrooms as well available.
Well, I mean, then there's more free things to do, I suppose. So I am happy that this is not coming from the tax base. But I do want to ask a bit more about the bike share strategy. So that was a recommendation from the waterfront plan. We currently have bike rentals going on, as you mentioned. Are those well used?
So through you, Mr. Mayor, I can give you some stats for the 2023 season. Like Mr. Peters had indicated during his time here at the mic, there's a lot of tourists that come through cycling. And I can say that we did have quite a few international cyclists that came through from the UK, Brazil, US, France, Germany, Switzerland, and Belgium. And bike rentals, we had a total of 173 rentals in 2023, and compared to 130 in 2022.
That sounds pretty good.
Yes.
Especially for a new program. How many bikes do we have?
We have 6 bikes.
Not bad. And are they still in good operating? They still work?
Yeah. Through you, Mr. Mayor, yes, we do have them tuned up whenever it's needed, and we supply helmets as well. And the staff at the marina give them a little tutorial and help them set up the height of their seat and all of that.
Perfect. What do we charge for?
$25 a day.
Okay. Okay, that's interesting. I don't know how I feel about the strategy right now. Just, more studies. Public art strategy. What is it that we're hoping to gain from that exactly?
Through you, Mr. Mayor, I believe we're looking to do, it's related to the waterfront, and so a popular sentiment that's been expressed out there is the lack of public art in our park spaces, and particularly along the waterfront. There have been a few recent initiatives by city staff to retain artists to do some murals. We did a mural behind the museum as well, the diversity mural across from the bandshell, and so it's to sort of further those efforts and to seek artists to. At the end of the day, we're not necessarily artists ourselves, but to try and develop a strategy to encourage artists to, or commission artists to come and do work or installations within our park space and along our waterfront.
So in this budget, we don't actually have any dollars dedicated to commissioning artists to do public art, correct? It's just for the strategy?
Through you, Mr. Mayor, yes, that's just
How
the
much did we
strategy.
pay on those murals that you were mentioning, the diversity one and the, I think it's 1882?
Through you, Mr. Mayor, I can't recall offhand. I think, if I would, to be honest, it's probably not an amount that was enough. I'll say, you know, I'll say we've had some artists do some great work for us, but it's been somewhat of a donation on their part. I'll say the pop-up containers over at currently at the Cornwall Square. You know, what we've done is we've supplied, usually it's a nominal honorarium. It might be to $1,000 or something, and we supply materials as well. So again, the artists aren't necessarily out of pocket themselves, but if you were to put that honorarium into an hourly wage, it would not be sufficient. And again, that's part of one of the goals of the strategy is what's an appropriate sort of dignified commission for an art installation.
Yeah, art is work and should definitely be paid as such. I'm of the opinion that I would rather see that money spent on art and paying artists to make art in our community. I know in Toronto when I visited there, I went on I did a graffiti tour, and they mentioned that their program that they had actually came from trying to prevent people from doing graffiti, and what they found was better to lean into it. There's a respect in that community for people who do street art, and that if you have nice pieces of art that are out in public spaces, they're less likely to be tagged because there is that respect that comes from the community. And so they ended up totally pivoting what they had done in their good planning. So, you know, sometimes ready, fire, aim is not a bad approach whenever it comes to something that's something like art, in my opinion. Thank you.
Councillor McDonald and Councillor Hollingsworth.
Mr. Mayor, so I just want to go back to the beach for a minute. So this might actually happen this summer, or it's going to be after the boat launch?
Through you, Mr. Mayor, I would say probably not going to happen. Construction probably wouldn't happen this summer. We hope to have the design work completed, and I'll say we have been in discussions with the Waterfront Committee. We are in discussions with Ontario Power Generation, who owns the property, to get their buy-in or make sure that they don't have a fundamental objection to introducing a beach activity on that property. As well, some members of the committee did raise some good concerns as to whether or not we should speak to the Raisin Region Conservation Authority, the River Institute, and the Health Unit to see if there are any water quality concerns within that body of water. We are aware that there is a public beach not too far west within South Stormont, across from Lakeview Heights, as well as some within the St. Lawrence Parks Commission. And so we think that portion of the St. Lawrence is certainly should be a suitable water quality. However, we will be reaching out to those agencies to see if there is any more specific data specific to this location that might indicate whether or not it's try and vet that before we retain a consultant. But part of our consultant's design work will be to do further evaluation of the suitability of it before they get into the producing a design. So looking at water depths, if any dredging work is required, and what approvals would be required in order to do that in water work.
Yeah, because I swim in Longsoon, I swim in Lakeview, and when we used to have a dog, I used to swim at the boat launch. But not near the boat launch where it's nice sandy bottom, but at the north end where it's very rocky. And you have to walk quite a ways out on rocks, which is not fun, before you can get deep enough to swim. So you're thinking of some serious dredging you must be, eh?
Through you, Ms. Mayor, that's part of what we'd like them to look at, is to see, and you're right, I do some boating up in that part of the river, and yes, there are stones and boulders as well. I suspect would need to be removed as well. looking at, I think our waterfront plan even had proposed an inflatable water park, which would likely be a private contractor that we would, look to enter into I've seen in other swimming spots across the province where a private contractor will charge a rate and put a bracelet on a child that allows them to run all over an in-water kind of inflatable jungle gym, I guess would be a way to put it. But to look at the depth of the water within that basin to see if it is suitable for those kinds of activities or not.
And see how far you can go before you hit currents.
Exactly, that too,
There's that
yes.
big dam warning there, which is a good thing to see. So it strikes me that most of that money wouldn't get spent this summer.
Through you, Mr. Mayor, no, I don't expect so. I think it would, but having it approved would allow us to put out a tender in the fall, award it to allow for construction in the early spring, as opposed to having to submit it into the 2025 budget, wait for approval, put it, and then put out tender documents.
And my last question is the consideration for the boat launch, putting it maybe on the other side of the peninsula, like it's on the east side now. Could it go on the west side?
Through you, Mr. Mayor, the boat launch ramp itself has been upgraded within the last 10 years, and as well as the docks that the boaters use. So it's anything could, the design hasn't been completed, so it is possible. But I would say the prevailing winds come from the west, and so having the boat launch and the docks located on the east side of the point does provide that protection to those prevailing winds for boaters. Typically when you come, you tie your boat up to the dock, and then you walk to access your vehicle and trailer and come back. And if it's exposed to sort of wind and wave action, then it becomes a bit of an undesirable location to launch your boat.
Councillor Hollingsworth.
Thank you, Your Worship. If I could ask for your indulgence, I know planning has already come by. Realize there were some questions that I didn't get to ask on Monday night. If it's in keeping, I know we're on rec. If I could, a couple of quick questions with regards to planning, if that's in order.
I also had some questions. Maybe we can just wait till recreation is done and we can come back to planning.
Whatever.
I think that works best because
Okay.
they'll be around for
Jibo sit there
follow-up
under
questions.
under the bright lights. I'm perfectly fine with that.
Any further questions from council? Okay, I just had a couple on this one. I share some of the concerns raised by my colleagues about, say, the bike share strategy and the dog park study. So for bike share, as we attend conferences and whatnot, and just some background too, living in Toronto for 12 years and seeing the Big Seat program, which later got absorbed into Toronto Parking and how that was structured and everything else, and going to conferences and engaging with the representatives from these various companies, whether it be bikes or scooters and other ones, typically they can provide a plan. You approach them as a municipality and say, we're interested, what would that look like? And they'll draft that and propose it, because in the end, if they're awarded a contract to operate the system, that's where they get compensated for. So I think perhaps we should consider that instead of hiring another consultant, because they may recommend approaching one of these organizations. And I think, if they're going to do the work and we have different proposals on the table from different options, that could really determine what the best one is. It's like putting out a request for proposal, getting proposals, and then this one works. Same thing with the dog park study. I mean, I understand some of the concerns. Again, Toronto's had them for probably 20 years or longer. And I think right now, if we look at the unofficial one at OPG at the dam, it works. And it wasn't meant to, but it works. And OPG has put up signs, clean up after your dog and everything. So they're not discouraging it. They're kind of encouraging it. So maybe the answer is to partner with them and say, okay, this is the dog park. We will say this is a dog park. I mean, there's other considerations there. But that's an area that's so far removed from a public road. I know there's an access road to get to the dam. Maybe fencing is not an issue. But it just seems to work currently, and it's not near any homes. And so, a lot of the noise concerns, maybe that sort of stuff, that won't be a problem. So, I think these are things that maybe we can consider to take away to Councillor McDonald?
Just a quick question to Ms. Bailey on this respect. I see this money is coming from the Canadian Community Building Fund. So if, for example, we decided not to use some of it as designated here, does it go back in the pot, or does it go back to the federal government or whoever it came from?
Through you, Mr. Mayor, the 4 projects on the page are funded different ways. And so if it is funded from the Canada Community Building Fund, that is the city's money. The money would be transferred back to the reserve to use for other infrastructure projects.
All right, I think that's it for recreation. Thank you very much. What's the next?
Sorry, Mr. Mayor, when I stepped away to make a phone call, I didn't realize you had finished all your capital.
Okay.
Just a very quick comment. Very happy the floor is going to be replaced in the hallway.
I think, pardon me, sorry to interrupt, Councillor Hebert, but we only covered the capital for which includes the
rec.
waterfront
We haven't
plan.
got to, understood.
The facilities capital does include a number of recreation items. But, Mr. Mayor, I don't know if now is the time we wanted to talk about the report for the multi-sport recreation facility, which we did provide, or if we want, or if the intention is to continue on through facilities, and if there's another stage in the present to discuss that, happy to.
Councillor Hollingsworth?
Maybe I'm missing it, but I see that particular report as a regular council meeting item report. I realize it has budget implications, but it's not like we're gonna put money in the budget this year on the fly. Let me ask you this question, Mr. Fothrop. Why do you think it should be discussed here? Or does it make a difference one way or the other? Like, why did you hand it to us at a budget deliberation and say, here's the report, good luck, figure it out on the, when typically this would have been something I would have seen on a regular council agenda?
Through you, Mr. Mayor, yeah, either or it makes no difference to us. I think because it would qualify as a capital project. It was, I think, some of we met internally with the senior team and decided that bring it toward one of the budget meetings would be appropriate, but,
Is there money in the budget for any of the parts of this report?
Through you, Mr. Mayor, I think in that report, we're suggesting that a project of that scale would be financed, and so it would not necessarily have a...
Not going to have an impact on the tax base directly either way.
Councillor, in supporting what Mr. Faltrop is saying, when your motion was passed, I believe it was in February, it required us to come back through sure. Yeah, we'd have to look back. Ultimately, the report's in front of you attached to this document. If you're not, if you don't believe it's the right environment, you can you could table it, and we would be glad to bring it at a upcoming council meeting.
Well, Your Worship, with love, it's ultimately at the will of council, whatever the majority. I can wade into the discussion either way. It doesn't matter to me, but.
Okay, I mean, if you want to raise questions now. Okay. Councillor McDonald?
I would move that we discuss it in a regular council meeting because I think it's a huge issue and we've got already sufficient on our plate.
I know I said I wouldn't allow motions right now, but I'll make an exception because of what it is. So, motion to defer, Councillor McDonald. Seconder, Councillor Hollingsworth. I don't think we really need debate on this. All in favor? It's carried. Thank you. So then we'll continue with city facilities, please.
Thank you. I'll have our manager of facilities, Mr. Neil Dixon, join me. You'll note that Ms. Gibault is staying. As we get into the capital, there are quite a few capital projects that do have are either recreation driven or recreation implications. Our operating budget, I can walk you through our variances. There's a net increase in salaries and benefits of $329,000, which is largely due to anticipated increase in wages as a result of incremental and contractual obligations. We have a $39,000 increase for purchase of goods. This is largely related to a projected $35,000 expenditure to upgrade our security cameras at the Cornwall Civic Complex. In services and rents, we are estimating a $105,000 increase, which is largely related to contracted services for snow clearing, as well as our plumbing, heating, and air conditioning services. We've adjusted these expenditures to reflect the 3-year average that we are seeing. For financials and transfers, there's a $105,000 decrease due to some debt that has reached maturity. Through our financials and transfers, there's a $162,000 decrease. Again, as mentioned as part of the recreation budget, this is largely related to the transfer of the $155,000 contribution to the Historical Society that's been moved to the recreation budget. Our contributions to reserves will increase by $50,000. That's intended to help cover future capital costs within the department. As well, overall, there's an increase in revenue estimated at $112,000. This increase is largely related to increased revenue from the Progress Fund, but it's also offset by a reduction in revenue from the CCBF grant, as well as a reduction in withdrawals from reserves. Happy to answer any questions on operating before we present capital.
Councilor McDonald.
Mr. Mayor, just a factual question. Is CCBA, is that the new term for the gas tax? And
Through you, Mr. Mayor, that's right. Previously
Okay.
referred to as gas tax.
And somebody raised the specter yesterday of, say, if we had empty, or not, full buses rather, that instead of increasing the gas tax, they reduce it. So we had, obviously, a reduction in the CCBF this year?
Through you, Mr. Mayor, it's a reduction to facilities-related projects. I think our finance department would probably be best positioned to comment as to overall if we've received less gas tax funding this year as compared to previous years.
Through you, Mr. Mayor, so when we're talking about transit, we're talking about provincial gas tax funding, which has not had a name change. When we're talking about the Canada Community Building Fund, that's the federal gas tax program. Those monies are directly put into the reserve, and then to Mr. Fothrop's point, they're taken from reserves based on the capital requirements for that year. So it may fluctuate year to year.
Thank you.
I believe it stayed approximately the same.
Okay, thank you.
Any further questions on operations? Okay, we'll go to capital.
I'll draw your attention to page 158. We've grouped our capital projects based on facility, and you'll see in 2024 will be a big year for the Civic Complex. And we've got a number of larger projects that have been looming that we are hoping to advance. One of the first of which is the front steps and patio replacement. This is a project we have initiated already through a design exercise. So the design work is well underway. We are seeking $3.5 million for construction dollars to be able to put that work out to tender. The condition of the steps has deteriorated. The reinforcing steel within that concrete is corroded, and we've had to complete a number of significant repairs in recent years. And it's becoming a liability, and we are proposing to replace it with a new set of stairs located within a building addition, so that those stairs would be located inside, and then which would create some maintenance and operational efficiencies, and would certainly reduce the amount of salt that we need to put down due to the exposure that these stairs get. The next project is the replacement of the lower level flooring in the beneath the main the lower or in the lower level concourse. It's largely an aesthetic improvement. However, there are some operational challenges in which, if anyone who's been in the salons for an event, we have carts that staff use to bring materials throughout the facility, and it can be quite loud and disruptive when those carts roll across that ceramic tile. The next item is the upgrades to the main floor washrooms off of the main concourse, a $65,000 project. Again, largely in aesthetic improvements, as the washrooms have become a bit dated and due for a refresh. The next item is sort of a multi-year item. This would be the first year to replace the arena roof. The arena roof's about 20 years old, and we are seeking to begin that project with the first phase. The next project is the north interlocking patio redevelopment. As Councillor Gardner identified earlier, there is this interlocking brick patio located opposite of the Civic Complex main front steps on the north side of New Zealand. At one time, it used to be a fountain. Over the years, the fountain's been closed, was no longer functioning, was turned into a planter. As you can see, water puddles there. And so we are looking to redevelop it into sort of a new, fresher seating area. And then the next item is the arena floor design and replacement. This would be the hockey arena floor, is original to the building, and so it's approaching 50 years old. And this project would replace the concrete slab, the cooling piping within it as well. Typically when the arena floors are built, there is a heating layer underneath that slab that prevents frost from going into the ground and heaving up the slab. That heating system at the complex hasn't worked since the 1990s, which is why right now we keep ice within the summertime at the Benson Center, instead to try and give the chance for any frost beneath the slab to come out of the ground. And so what this project proposes to do is replace that entire concrete floor slab and provide a new heating system, new cooling system, and as well as new boards and glass. The next project is a $120,000 project to replace the carpets on the first floor of the Civic Complex. The carpets have become are due for replacement. There are stains that cannot be removed, as well as some holes that need to be patched. We propose the new carpets would be the tile style carpets, so that if there is a stain that can't be cleaned, a tile can be removed and replaced without having to recarpet an entire area. The next item is the ice plant room ammonia ventilation to the rooftop. Currently, our ice plant contains ammonia, as do many ice plants. Ammonia is a very dangerous product, very hazardous. If there is an ammonia leak within the ice plant, there is an exhaust system that is meant to expel that ammonia to the exterior. And since its original construction, the exhaust vent for that pipe happens to be located closer to ground level, within the vicinity of one of the emergency exits. And so staff have identified it as a concern that vent piping should be extended up towards the roof, so that should anybody be within that vicinity, when ammonia is being exhausted, that they are protected. The next item is the salon ABC renovations. We are proposing a project to do an aesthetic improvement to the salons with starting with the removal of the asbestos, which lies within the walls, provide for new LED lighting, replacing the ceiling, and replacing the sound system for the space. The next item is what's called the exit ramp replacement project for $125,000. As many of you who've been to the Civic Complex will know that there are emergency exits around the perimeter of the complex. That's a concrete kind of walkway from the arena doors to the grassed area. It's somewhat of a pedestrian bridge, I'll say. You'll see the photo provided in the on the sheet, which shows some rebar that's corroded, again due to 50 years of salt applications, has corroded the rebar. We would like to proceed with the rehabilitation or replacement of one of the ramps, looking at the south exit ramp as being the first of those ramps to try and tackle. On page 162, the next facility would be the Aquatic Center. At the Aquatic Center, we had a past project in the 2023 budget for $125,000 to replace the sprinkler piping within the pool area. We put this out to tender and received no bids. In inquiring with some of the contractors who picked up the bids, they advised us that the scaffolding requirements to access the sprinkler piping above the pool was a major challenge, and indicated that the amount that we have budgeted was not sufficient. So we are seeking to budget for an additional $375,000 to complete that work. Another improvement at the Aquatic Center we propose is to install automatic sliding doors. We're looking at 3 sets of doors at the Aquatic Center, 2 within the main sort of vestibule entrance, and then another where that separates the Aquatic Center lobby from the Civic Complex arena. Very similar to what we have at the Benson Center, with kids using this as the main sort of access to the hockey arena, carrying hockey bags. We see a benefit to these automatic sliding doors that open before the patron sort of gets to that doorway. The next item is some heat tracing for the rooftop for the value of $35,000 on the west side of the Aquatic Center. The roof slopes back towards the Civic Complex building, and the idea is to have heat tracing cable there to melt any ice accumulating on the roof to prevent any ice damming on the roof, which can lead to water coming in the building. On page 163, we have one item proposed for the Benson Center. This is called the snow melt pit coil replacement. What you see there is a photo of a coil that lies within a pit in the back sort of maintenance area of the Benson Center, which are ice resurfacing machines. When they clean the ice and scrape the snow off of it, that snow is collected in a hopper, and when they leave the ice, it dumps it into a pit. And then what's put through this coil is we use the waste heat from our ice plant, and we put the glycol solution through this coil that rejects some of the heat, that waste heat from the ice plant operation before it goes to the cooling tower. So again, it helps reduce the mechanical cooling load on our ice plant system. This coil has become corroded throughout the use at the Benson Center and will require replacement. On page 164, we're listing our outdoor facilities. Our first project is a design project for the next outdoor pool basin repair project, $130,000. We've recently awarded the construction to rehabilitate Mattice Park, the outdoor pool in Mattice Park. We would like to in 2024, complete the design work for the rehabilitation of the outdoor pool at Reg Campbell Pool, and then budget for the construction dollars in 2025. The next item is our outdoor bleacher replacement. This has been a multi-year program in which we have been replacing our outdoor bleachers at about 5 sets of bleachers per year. This would be the 5th year, I believe, of an anticipated 6-year project. The next is a marina dock replacement and upgrades. Over the last few years, we had been budgeting to incrementally replace some of our docks at Marina 200, and we are proposing a $75,000 project to continue that initiative and slowly see the docks replaced over time instead of all at once. The next is in our sort of recreation and playgrounds area. We've got our a tennis court resurfacing project for $200,000. This is a multi-year project which we've had begun, and as you heard at last night's town hall meeting, there has been some definite challenges at finding the proper contractors to do that work. We've tendered work and been unsuccessful at finding contractors. We are happy to report that we were successful at finding a contractor to resurface some of our tennis courts. This $200,000 would be the final amount to be able to complete that initiative, and would also, we are still working to construct the pickleball courts, and we do have budget from past years to do the pickleball court at Broadview Park, as Ms. Forget was looking for. However, we are actively seeking out contractors to try and get pricing from them, as we have put it out to tender twice with no success. The next item is ballpark lighting for the Reg Campbell ballpark to convert existing lighting to LED. The existing lighting is old technology that is not energy efficient. New LED lights will be much more energy efficient, as well do not pose the same maintenance challenges with having to replace bulbs. Our next item is a Alexander Park basketball court for $200,000. As you may be aware, there is a proposed youth space, phase 1 of a youth space that was approved for Alexander Park. One of the recreation amenities identified by the youth focus group as being most desirable was a basketball court. Our existing court at Alexander Park is small, in poor condition, and in need of replacement. So we are proposing to replace this court with a more appropriately sized court that would complement the proposed youth space development. The next project is a bike path retaining wall structure for $2 million. There was a capital project approved back in 2019 that we were not successful at completing. We did put it out to tender, and unfortunately, bids were over budget. We were not able to award. We've seen a drastic increase in the cost, and so we are budgeting, or we've included within this budget an additional $2 million to be able to replace that retaining wall. There are 4 sections of retaining wall. I would say that along Montreal Road, at the west end, it starts around Glen Storden Lodge, and there are 4 different sections. And the most easterly section is near the Marina Co-op, near Boundary Road. There's a grade differential between our bike path and the river's edge and shoreline, which necessitates this bike path, or this retaining wall, which ranges in height from about 2 feet tall to about 5 feet tall in some places. The next project is our annual playground structure replacement project, which we've budgeted $150,000. Our recreation master plan recommended that we replace our existing inventory of playground structures at a rate of 2 per year. If you recall, in 2023, we had, Rachel's Kids had proposed a new inclusive playground structure for St. Teresa Park. And it's part of that, supporting that, that project. Our existing playground structure would have been due for replacement in 2025. We would normally have budgeted $75,000 to replace that structure. Given the nature of the group that the users that the inclusive playground intends to serve, we recommended that that development also incorporate some barrier-free parking within the park. And so we proposed that the $75,000, and this, I suppose, this was approved as part of the council report approving the Park of Hope for St. Teresa Park, that the $75,000 we were planning to spend on replacing the playground structure would go towards constructing the barrier-free parking stalls within the park. The other playground structure that we're planning to replace is the playground structure at Satya Sai Park for $75,000. And then we have our bicycle $50,000 project to resurface our bicycle path. This is an annual project which we seek to resurface anywhere from 1 kilometer to 1.5 kilometers of our bike path, which this level of funding allows us to resurface our bike path on about a 30 to 35 year cycle, which is sort of about the time frame that we're seeing that the path becomes due for resurfacing. The next project is the East Ridge Subdivision Park Development. At the East Ridge subdivision has been a subdivision that's been progressively expanding over the past 25 years. A recent development of this, a recent phase of the development included a parkland dedication, and our recreation master plan had identified that recommended that residents have access to a neighborhood park space and play structure within an 80-meter radius of their home. Currently, this neighborhood is underserved with, because it does not meet that standard. The nearest park is Menard Park, which is in excess of an 800-meter walk for most homes in the neighborhood, which has identified the need to develop this space into a neighborhood park to serve those residents. Our next project is the St. Teresa Park upgrades. We're proposing a $50,000 project to improve the accessibility at the public washroom at St. Teresa Park. Again, this is intended to align with the inclusive playground the Park of Hope proposed by Rachel's Kids. We're proposing to do with these funds are improve the entranceway such that there is no lip, upgrade the washroom to include accessibility features like an automatic door opener and locking mechanism, raised toilet, lowered sink, universal changing bench. As well, we are proposing to have a water bottle filling station installed, some additional surveillance cameras. As well, the group did identify a need for some additional fencing around the perimeter of the park, as some of the children that they expect to access the park can be prone to run, and so trying to confine those children to within the park space. Next is the band shell sign replacement and equipment upgrades. We have a band shell sort of reader board that we have staff use letters to put on that board to advertise the Arts in the Park, our programs, as well as other activities that are taking place at the band shell. We have identified that the condition of that sign has deteriorated. It has been, the letters have become yellowed and the tracking is breaking, and it is proven to become increasingly a challenge to maintain and operate. We are proposing a digital reader board in which different graphics and images can be displayed to help promote events within that park. We were also proposing to purchase some special events amenities as well to help support some of the special events that happen in the park, such as additional sort of power outlets and cable covers, some bike rack barricades that you've seen us use, as well as some folding tables, round tables, and some onstage storage improvements to help complement some of the event activities that take place on the band shell. Within the municipal facilities area, we've got our Justice Building elevator upgrades. This is a $200,000 project, which is intended to upgrade the third of the 3 elevators. Previous budgets included funds to upgrade the first 2 elevators. This would upgrade the remaining elevator, which we've identified the controls of these elevators have become obsolete, and any issues with the elevator could result in it being out of service for an extended amount of time. As well, the next project is a $50,000 project to do some asphalt resurfacing work at St. Clement's parking lot. The City of Cornwall typically leases 34 parking spots from St. Clement's Church. In the past, the city has had a lease agreement with the church by which we enter into a 3 or 4 year term lease to use those parking spots. In return, the city has done some asphalt sort of resurfacing work or made some investments into improving the parking lot. The current lease agreement has expired, and we are trying to work with the church to develop a new agreement. We would not proceed with the asphalt improvements until an agreement were signed and in place, but that is the intent. The next project is a arc flash risk analysis for $100,000. In 2018, we completed a project to conduct a review of our electrical panels within the city to identify the potential hazards that could result from an arc flash. It's a CSA safety requirement, which also requires that an analysis be done every 5 years to ensure that staff who have to access those panels are properly protected. And so we are at our 5-year mark, and an analysis is due. Our last project is an asbestos remediation of city facilities. The city has 19 city buildings that contain asbestos in various forms. The city's long-term plan is to remediate these buildings and remove as much asbestos as feasible to do so. Asbestos, if not disturbed, is not a cause for concern. However, we are recommending that we proceed with actively looking to remove that asbestos and remediate the building. In 2024, we are proposing the Cornwall Public Library in that the ceiling within the plaster ceiling in the basement be remediated.
Short list. Thank you. Just a note, we're at 6 p.m. Dinner has arrived, so what I'm thinking is we adjourn for dinner, come back to this department for questions after if council's amenable to that. So we'll do half an hour again. 6:30 we'll start questions. Thank you. All right, council, administration, we're looking to get started back up here. So we're on to questions for our facilities. I do have a small speakers list started during the presentation. Councillor Bennett had put his hand up, then I have Councillor Hebert afterwards, and then we'll go from there. Thank you.
Thank you, Mr. Mayor. We made reference that you couldn't find a contractor to resurface the pickleball courts, but we can find contractors to resurface tennis courts. What's the difference between the two courts?
Through you, Mr. Mayor, actually, it took quite a while to find a contractor to resurface the tennis courts, but it's not a complete replacement of the asphalt. It's that color coating that's on there is what is going to be redone on our tennis courts.
Oh, okay.
But as Ms. Forget was describing, we're going, at Broadview Park, the condition is deteriorated to a point where we think it's best to replace the asphalt. But then when we talk about the reconfiguring of the space for pickleball, so right now, each tennis court gets subdivided into 4 pickleball courts. It's a little bit crammed, and so the proposed reconfiguration will be 6 well-spaced out pickleball courts as opposed to 8 kind of crammed in. And right now, the pickleball activity, it's 2 days a week at Broadview Park and 2 days a week at Terry Fox Park. And so by making it 6 courts that are 7 days a week pickleball, again, it really will improve the availability of pickleball facilities. And then our nets as well. Right now, Ms. Forget was explaining how it's portable nets that they make use of. And what we're proposing will be in the ground post pickleball nets. Historically, they used to use actually the tennis nets.
Mm-hmm.
And pickleball nets are a couple inches shorter than tennis nets, and so that was a bit of a problem. And so she mentioned in 2016, we created these lines on the courts to allow for the activity and bought the portable nets, because what would happen is a pickleball player would show up, drop the tennis nets a couple of inches, then someone shows up to play tennis, and now that the net is too low to play tennis and they don't have the proper tools to crank it back up. And so it remains in that position until our staff arrive the next day, see it's been lowered, and raise it up. So I think by establishing dedicated facilities for each activity, it'll result in a lot less conflict and better facilities for everybody.
Okay, and did I hear you say that you have money set aside for the Broadview Park from previous year?
Through you, Mr. Mayor, yes, that
Okay.
that is correct. That we do have the funding in place, and it's just a matter of it. So with Broadview, in order to find someone to do the asphalt work, it's not nothing against the local asphalt contractors. It's a bit more of a specialized work than, you know, hiring someone to come and do your driveway. The paving tolerances for sports courts is very tight, and so it's a really delicate, sort of refined process. And so our hope is, with right now we've got a budget from last year to redo the basketball court at Matisse Park, and in this year we have a project to do the basketball court at Alexander Park, and as well now the pickleball court at Broadview Park. Our hope is now we've gone out and tendered a number of times, and so we're actively calling contractors from across the province and even into Quebec as well to see who's got the availability to do it and interest, just to get a price. So we're making those calls to try and because our other procurement methods just haven't produced any results, and the contractors that we have been speaking with are telling us just that. They're booked a year in advance, and so they're not actively seeking or submitting prices on tenders. People are coming to them, and a lot of them, we're finding out their plates are already full for a year in advance. So.
Yeah. All right, well, that makes sense. The other one I had a question was about Alexander Park. We're talking about doing a bigger basketball court for the youth organizing group. If I was under the understanding that the youth organizing group had some money to spend and had some plans to do extra things with that park, is there anything holding that up, or?
Through you, Mr. Mayor, right now they're approved to do a phase 1, which includes a gazebo with some supporting amenities. They're looking at, you know, outdoor chess tables and some seating areas. So they do have funds to do that, and they are working with us. They did provide a design recently for the gazebo structure.
Okay.
But the funding that they received is limited to programming. It can't be used to construct facilities like basketball courts or other recreation kind of infrastructure.
Okay.
So which is why we've identified that our court is deficient and in need of repair. And so we've decided to prioritize that court to sort of align with that youth space project.
Okay, and that park has an outdoor rink in the winter?
Through you, Mr. Mayor, it always had. The volunteer that used to look after that was Rick Forrester. He did it forever. His kids have kind of grown up, and so it hasn't had an outdoor rink in the past few years, but the facility, the connections are there. And so again, if there is a volunteer looking to take that on, we will go and put the boards back up. We have them, we can use them. And so, but typically with our outdoor rinks, it's all dependent on whether there is a volunteer in place that's willing to take on that commitment.
Okay, I heard one of the ideas from that group was to put like a permanent pad down. Did you hear anything about that?
Through you, Mr. Mayor, no, I hadn't.
Okay. Well, I guess you maybe get ready to answer your phones shortly. Yes. Okay, thank you very much.
Welcome.
Councillor Gunjo?
Thank you.
Sorry, correction, Councillor Hebert first, then Councillor. It'll be yourself. Sorry.
Hard to know when some of these things are coming, so sneak out of the room when I can. Overall, just so many great things coming up this year. Your department's going to be really busy. Love the addition of a few additional accessibility items to go with the Park of Hope. Really happy to see that. Like I was saying earlier, really happy to see the floor upgrade. I know it seems like the silliest complaint, but when you're sitting there hearing a guest speaker talk about their lived experience about something important or traumatic, and all you hear in the background is that, like, it's a big impact to events that are happening there. So happy to hear that. And just the overall upgrades of the salons, I think that's going to be really excellent. I'm wondering, obviously, then the space will be out of commission for a little while during those upgrades. Has the potential lack of revenue been addressed in the budget because it seems to have an increase? Or can we work around still renting the space and doing upgrades kind of in between?
Through you, Mr. Mayor, we haven't sort of finalized a schedule yet as to when we would do that, and we would have, there are some significant community events that do take place in that space, and so we would do our best to try and seek to minimize that disruption as much as possible, but we don't have those
fine.
details at the time.
Love the sliding doors at the aquatic center. I have, for other reasons, had to lug things in and out of there for events, and not convenient. So the sliding doors are really great. And a bunch of the upgrades I'm seeing, I feel like, oh yeah, I had an issue with that once, or just like really great, like things coming to all of our facilities. Has anyone ever brought up the condition of the stage floor at the bandshell in terms of things that could possibly be repaired in the future?
Through you, Mr. Mayor, I'm not aware of necessarily any complaints specific to the stage floor. I guess I am aware that we have our staff that do operate the arts in the park have identified that the bandshell is showing its age for sure, and soon at some point in the future that might be something to consider a replacement of the overall facility as well. There has been some discussions in the past as to regarding some of the noise complaints that generate because of its positioning, and the sound projects north right up Pitt Street. If any act goes beyond 11 p.m. or a minute past 11 p.m., we get complaints as far north as 9th Street. That they hear it loud and clear. So there has been discussions about possibly whether it should be reoriented one direction or another. But I haven't had any specific complaints about the stage floor condition. But there are a number of other deficiencies within that building that we are aware of.
And it's a very well-used facility, so that would be something I'd love to see in the coming years. Just on a note from conversations I've had with performers, more specifically dancers, may have issues with the floor that's there. You can't accommodate everybody, but anyone who's moving around has a bit of a hard time on there, so just thought I would bring it up. That's it, thanks.
Councillor Ngunjo.
Thank you, Mr. Mayor. I think this will be for the financial department, or maybe you have the number. But I see that we're going to spend 11.5 million in 2024, so this year. That's the total capital that you're asking. I wanted to know the total capital of the 2023 and 2022, if possible, please.
Through you, Mr. Mayor, I don't happen to have those numbers handy, but I could find them. Through you, Mr. Mayor, we do have a 2023 number here that shows 3.952 million. I don't have 22 though.
Okay. Yes, that is my point. Is last year we spent 3.5 roughly, and we're going to triple this amount this year. Is there any explication or any explanation of why this total capital is so high in 2024?
Through you, Mr. Mayor, yeah, there are a couple of major ticket items that are in this year's budget. So the front steps of the Civic Complex, that's a $3.5 million project on its own to be financed, particularly projects of that scale we typically finance. As well, the Civic Complex arena roof is $1 million, and the Civic Complex floor slab is $1.5 million. So again, those are some substantial projects that where those assets are coming due for replacement, but they just happen to fall within sort of this year. But it's really about the asset needing to be coming due for replacement. The other is that even though the budget maybe gets approved in 2024, something like the arena floor slab, we would advance design this year. The actual construction dollars, a lot of these projects would be multi-year projects. So the construction dollars for that would roll over into 2025 as well.
Okay, thank you. I get the point that some of those need to be changed or complete this year, but I was wondering if there were not a possibility to split all those projects during the 5 next year to balance that, but I get the answer. Speaking about the front step and patio replacement, it's a 3.5 million, so looks very high for me. I don't know, is there...
Through you, Mr. Mayor, it would not be a like-for-like replacement. So the way that right now the front steps are these large exterior concrete front steps exposed to the elements, a real maintenance challenge, creates accessibility issues too for people accessing the building. What is proposed is building out the building to replace those steps, but also enclose them as being inside the building. So that's why it's if you're looking at the photo of the existing steps and thinking that that's what the replacement would look like, that is not. The replacement would look completely different.
Okay, thank you. Thank you, Mr. Mayor.
Councillor McDonald.
Thank you, Mr. Mayor. So 2 questions. The first one is about the steps at the Civic Complex. Given the proximity of the Lionel Chevrier building across the road, the glass building, will the room that's going to be built around whatever steps we get, will it be glass? Will it be a see-through thing?
Through you, Mr. Mayor, I think I'll ask Mr. Dixon, who's been working on with our consultants on the design of that front entrance.
Through you, Mr. Mayor. To answer your question, yes, right now the preliminary concept drawings that we have The new vestibule, if you will, is completely glass. It's all
Good.
glass.
Good. And I know Jamie mentioned we'll have steps there. Will there also be an elevator, like almost as soon as you step inside?
Through you, Mr. Mayor, there, as you walk in the front door or come in the front door, you'll have two options. You'll go up the stairs, or on the west side, there's going to be a ramp that goes all the way down to the ground floor, where you would access the elevator.
Okay, so
But it would
a
be
wheelchair
all
or
enclosed.
person could walk down there. So it's going to be a bit of a hike down to the elevator, but I guess it's just a bit of a hike.
Through you, Mr. Mayor, yeah, right now, I'll say the front stairs does meet accessibility standards in that there is a ramp, the three legs of a ramp that go around the perimeter of those stairs. But as working at that building, as we've seen, if there's an individual that requires to use that ramp, by the time they get in the front doors, they need to take a break. And the other is our parking is at a bit of a distance away
Yeah,
from the front
yeah.
doors as well. And so, by the time that individual comes from the parking lot, gets up the ramp, they're taking a break before they continue up the ramp to access the main concourse and the elevators to take them whether to
Yeah.
any floor that they desire. So this will be a more direct route with basically a ramp that just goes straight through.
Yeah.
It'll go around the west side of
Yeah.
our
Well,
existing
much
front
improved,
entrance.
because the current ramp, I was there once when somebody was trying to navigate it in a wheelchair. It took three of us to push and pull that wheelchair past the last lap it catches the snow. So it was impossible. So that's good, but I just think it's a long way by ramp, but I think that's okay. A ramp's a ramp, and it's indoors, so a good thing. Okay, I think that's it.
Thank you.
Councillor Good.
Thank you, through you, Mr. Mayor. I'm wondering, in regards to the arena roof replacement, this was something that was asked yesterday in terms of, does the design include, or have there been considerations put to installing solar panels on the arena roof?
Through you, Mr. Mayor, no, there hasn't. We have had private companies approach us before seeking to do a potential partnership in which they would install solar panels on the roof. Quite often, what they had proposed was that they call ballasted solar panels. So they're weighted that they don't have to. One concern about fixing solar panels to a roof is what you see on the photo for our roofing is it's a membrane surface. By mounting solar panels on the roof, not using ballast, you're putting penetrations through at every location, which become potential sources for water to get in. It's something that could be done in the future. It was mentioned in the town hall meeting that Cornwall Electric has recently changed their policy to allow for solar panels. Part of our discussions with Cornwall Electric as well, they're quick to remind us that, again, if Cornwall is seeking to become net zero, they purchase their electricity from Quebec that is hydroelectricity, which is a very green net zero source of energy. So in the end, switching from off of Cornwall Electric electricity to our own generated electricity, to them, they're suggesting has no reduction in greenhouse gases because their source is not produced using gas-fired generators or other. It's using hydroelectricity.
Councillor, maybe just a compliment. So, not beyond the specifics here, we have an issue that we have to resolve with the Ministry of Energy. So, Katie from our team is seeking a number of follow-ups. We recognize there's a local reality, which is described by Mr. Faltra, but there are provincial Ministry of Energy obligations that we're seeking to resolve and clarify.
Thank you. And I think, aside from where the electricity is coming from and if it's reducing our carbon footprint or not, like I'm hearing from you that the intention from the city is then not to invest in solar panels on our buildings. And if not on the arena, why anywhere else and not there?
Through Mr. Mayor, we have not made that decision, but we're thinking that it would be more of a business decision as to try and, reduce electricity consumption costs.
Yeah.
And so that would be, I'll say, the fact that we're replacing our roof now doesn't preclude us from putting solar panels on the roof in the future, as the companies that have come to us have proposed ballasted, because it's a flat roof, a weighted solar panel that sits on top of our roof, then allows us, when it does need to be replaced in the future, those ballasted solar panels could be moved out of the way to redo the roof and then move back into position.
Okay, that makes sense, because I know on a typical residential roof, the best time to install is when you're doing your roof, so that you don't end up with your roof needing repairs before your solar panels need to be replaced. So thank you for that clarification. I'm really excited about the band shell sign, actually. I wasn't sure at first, and I thought, oh, 50K, like it's one of the few things that's coming out of the tax base, but I actually think that has so much potential to really bring awareness to the activities that are taking place in the park and beyond. And I know, I mean, I imagine it's a monitor of some kind, really, that, you don't have to physically go and actually change the letters. Somebody can be sitting in their office and it can be changed from anywhere.
Through you, Ms. Mayor, it would be very similar to like our display monitor outside the Benson, on the sign at the Benson Center.
Yeah.
Where, it could be done using a computer remotely.
Which seems to be quite efficient. I had a question, because I know in that item it referenced the yellowing of the plexiglass. I think that was covering it. I noticed at the clock tower the gears, I think, that are in that plexiglass container are in really rough shape. I didn't see it as an item in here. Has that been considered in terms of replacement? Do we have any idea of what that would even?
Through you, Mr. Mayor, no, but it is something we'll take note of and take a look at and see if that's something that perhaps could be accomplished through our operating.
Wonderful, yeah, and I mean, even just flies get into it somehow, even though it's apparently sealed, but they make their way through. I had a question about the Sathya Sai Park, the playground replacement, which is really the replacement of a swing set. And I see that in the recreational master plan, there's this indication that any park that is just a swing set to replace it. When I'm looking at this park, I mean, it's not even, you can't even see it on a map, really. It's literally just a swing set. It's 200 meters from Alexander Park, it's 600 meters from Adams Park, and it's about 800 meters from Optimus Park. Now, I'm just wondering strategically, is there any reason why this park is being selected, given that, what you had mentioned before around Bellwood Park, I'm forgetting the name, but that the criteria or the minimum is 800 meters, so we're well within that whole area has access to playgrounds.
Through you, Mr. Mayor, I think the other factors to consider is, what streets do they need to cross? So for Alexander Park being on 9th Street, again, we wouldn't want children from, I believe, correct me if I'm wrong, I think it's behind the Canadian Tire?
Yeah.
Yeah, and so for those children to, cross 9th Street, that's not something we would think was acceptable even within the 100-meter or 800-meter walk. Optimus Park, as well, you going north, you got to cross 11th Street. So there are some physical barriers to kind of consider. This is a park that's currently served with a swing set, and our recreation master plan does kind of try to recommends that at some of those locations where it's just a swing set, that we consider prioritizing them to install, replace the swing set, but also install a playground structure at the same time. So we more recently have done, Memorial Park was in that situation, as was Grant Park, was one that was in last year's budget as well.
Is that swing at the end of its life presently? Would it need to be taken down if we don't do the playground replacement?
Through you, Mr. Mayor, we would have to review the condition of it to see. I would say it's certainly, I'm sure it's at least 25 years or more old. Maybe Lori or Ms. Gibault could, if she has any more accurate information.
Through you, Mr. Mayor, I believe that that swing set was probably in the 70s that it was installed, and there had previously been a play structure there in the past, and it had been removed at the time. I think just due to not having the funds to be able to replace it when it was at its life lifespan.
Okay. I want to kind of bring up the fact that crossing those busy intersections, those busy streets is obviously a hazard, but to be mindful of the fact that we have a bike path that is adjacent to Alexander Park that crosses 9th Street, and there is nothing there. There's no flashing light. There is nothing to slow down traffic, and it is scary to cross. So I would argue that we're putting a Band-Aid on something that really needs to have a more holistic view to it, that we need to make sure that there's a pedestrian path that allows for people to cross, and especially as we consider, you know, what it's going to look like to have Alexander as a youth park, we're going to need to make sure that people, not just cars, but people can get across 9th and 11th as well. It's, you know, between really Sydney and Marlborough, there's nowhere to cross there. So anyways, that's what I wanted to ask about that. And I had a question about the north interlocking portion, or patio, I should say. 160K, it's funded through the CCBF. There was a fountain there before. It strikes me as like an odd area. Are we replacing it because we want people to use it and we want people to go there? Or are we just replacing it because it's aging?
Through you, Mr. Mayor, a bit of both, I guess. It used to be a popular, when the fountain was there before my time, I understand it was a popular spot for photos. We do have some flagpoles there as well. The area has become certainly overgrown. And then the condition of that patio and the fountain is such that it's really not a desirable place to sit outside. And I'll say maybe the front of the civic complex, there really isn't any space to really sit outside, and whether it's, you know, if a child on the ice inside and you want to wait outside for them to come out. It's a little bit of both.
Okay, I heard my counselor or my colleague whisper something about just throw some dirt on it, and I'm open to that suggestion. Throw some dirt, plant a few trees, and just, naturalize the area. I don't want to see us dump money into something that no one is going to go and sit at. And so, anyways, thank you for your input.
Further questions, comments? Councillor McIntosh?
Mentioned the fountain. I'll give you some background on that. That was when they built the complex. There was a local service club that donated the fountain, and it never worked. In fact, it was sprayed across Water Street and up into the complex, and so they couldn't repair it. So the service club refused to pay the bill, and the city took it over and tore it down because nobody in Canada knew how to repair this thing. So that's the history behind it. It only lasted a year.
Councillor McDonald.
Just want to throw out that area near the first bank of parking spots has a few picnic tables, and it's got shady trees. It's one of the few nice spots to sit in front of the complex. So, and this is in that neighborhood, I think. So I see people there sitting at those picnic tables.
Further questions or comments? Councillor Bennett.
Thank you, Mr. Mayor, through you. There's a few items here that, unless I'm completely blind, I think the heat trace, auto sliding door, and a couple of others that don't tell us how it's being funded.
Through you, Mr. Mayor, those all fall under the aquatic center, and so all those items are funded from the recreation facility.
Oh, gotcha.
reserve.
Okay, so I wasn't misreading it. Thank you.
Further questions? Okay, I had a few myself. Just with regard to the floor replacement in the civic complex, it mentions a new type of tile. Some facilities have moved to like an epoxied concrete or something like that. Can you describe the tile you're going to be using? Like, what's the durability of it? That sort of thing. Like, what are you looking at for material?
Through you, Mr. Mayor, I may defer that question to Mr. Dixon.
Mr. Mayor, that's certainly up for debate. The first thought was a vinyl floor, which is kind of rubberized, quiet, long durability, something similar to what you'd see in the hallways of the Benson Center, that would go lead to the dress rooms, something similar to that.
Okay. Councillor Good asked my question about the roof for the complex. You asked my question about the roof for the complex. Sorry, 1 second. I just had a question coming back to the retaining wall project. So as you mentioned, Mr. Fothrop, there was an original capital project in 2019. I remember that. It was budgeted at 1 million. And then you mentioned we weren't successful in getting contractors to bid on that. It's 2024, so what happened in the interim between 2019 and 2024? Because the cost has gone up exorbitantly. We're talking about 3 million now as opposed to 1 million.
Yeah, what needed to be done is a design exercise. The design was done in-house through our engineering department. Required us surveys and trying to prioritize that with existing capital works, which for that department are the predominant I'll say priority is our road construction projects. And so this is one we have been watching the condition of it deteriorate slowly and monitor it to ensure that it remains safe and that we don't risk losing any of the bike path as a result. And so it has, I guess, fallen a bit behind in the schedule. It was tendered in 2023, and we were at just based on the pricing that we received, we were not able to award it because it just exceeded our budget.
Okay, thank you. And then in a similar vein, for the underfloor heating system in the complex, it mentions there's compromise in the early 90s. We're in 2024. It's 30 years later, and we're looking to address this. Is there any reason for that?
Through you, Mr. Mayor, I guess before my time, but my understanding is that in order to do repairs to piping beneath the concrete surface means breaking up that concrete surface. And so, and you don't know where within that surface you've got your problem. So when you do have leaks in those systems, you could end up breaking it apart and chasing it all over the place. Now, I think anecdotal comments from staff is that throughout the years of operation and maintaining summer ice at the complex maintaining ice year round has led to frost getting in there and heaving up the slab. So whether that sort of heaving is what predated the system from not working and caused the system to break, I'm not sure. I can't speak for I guess why it broke in the first place, but to try and go and repair it now after it's been broken, we'd be doing spot repairs, trying to chase where the issues are. And at a 50-year-old concrete slab, it is just come due for replacement. And else, I would say that a new system would be much more efficient, similar to like the Benson Center with proper insulating layers as well beneath the heated layer so that we're not losing heat into the ground. And so it would be a much more efficient system. But regardless of whether that heating system works or not, it's come time to replace the concrete slab.
Yeah, thank you. I think personally, I would have liked to have seen this accomplished back then, but I mean, we're here now, so, okay, thank you. Okay, is that our final presentation? Councillor McDonald?
Thank you, Mr. Mayor. I don't have any questions about recreation or the facilities budgets, but I would like to raise the issue of our workplace recruitment and the medical recruitment budget line. So may I do so now? It's part of this budget.
We'll go, yeah, we'll ask planning, sorry. We'll go to I can't speak for some reason. We'll go to planning questions first, and then we'll come back to more broader questions about the budget at large. Councillor Huber, then Councillor Hollingsworth.
Thank you, Mr. Mayor. I guess when planning came up last week, it just went by really quickly. Planning, no questions, great. Okay, so we kind of missed it. It was getting late in the day, so I don't blame anybody. What are the vacancies in the department right now?
Currently, we have a vacancy for our planning manager position based on our approved headcount. I would say, and I think during my presentation last week, historically, that department had an additional headcount. And I would say sometime in the last number of years, partly, I think, because Mr. Boileau was a former planner and was able to offer that expertise to that department. That headcount was reduced sometime in the past 5 to 8 years. We're not exactly sure where, but historically, we all remember the days where we had, I'm sure they wouldn't mind me saying their names, but Mr. Alexander, Mr. Bedford, Miss Joyce Smith, Mr. Boileau, Mr. Doyle. So some planners that had many of them 20 plus years experience, certainly Ms. Doyle 10 plus years experience. Where we sit now, it's certainly nowhere near that level of experience, and about to begin a recruitment process to try and find a manager of planning. But the work that landscape, that recruitment landscape, particularly in the urban planning sector, is very competitive. The province has changed the legislations requiring quicker turnaround times for planning applications. And so many municipalities are upstaffing their planning departments to try and comply with those new legislated requirements. And so it's turned into a very competitive market, and it's proven really to be a challenge to find staff with the desired qualifications that we've historically had in those positions.
Okay, so it sounds like you could use one more to your staff count, because Mr. Boileau was so versatile and could be pulled in so many different directions, and we just can't seem to let him retire. And he sure deserves a retirement sooner rather than later. We do like having him, though. What are the plans for hiring the manager of planning? Has that been posted?
Not yet, but we're close. We have a posting close to being ready to go out. As well, we are in discussions with a consulting firm to help us in the interim, and possibly even once we do have a planning manager on board. We are seeing more complex planning applications than we have seen in our history. We're had a PAC meeting where the proponents presented a proposal for 10 Brookdale, proposing to increase our building height requirements. Again, a very interesting proposal for Cornwall, but certainly a challenge for staff to review, and particularly staff that are fairly young in their careers. So even talking to, like you say, Mr. Boileau, who's got lots and lots of experience, again, it's not it's a difficult application to consider and make a recommendation as to the appropriateness of that scale for our community.
I hope that's considered when the posting goes out, that we're lacking a lot of experience, and that if we can sweeten the pot for a potential candidate to come here to make sure that they have the experience the department is currently missing. I think it's really great to mentor young planners, but we don't really have anybody to mentor them right now. So if it's just such a junior team, so obviously we don't really micromanage decisions in terms of how hiring is done, but I would love to make sure that we can bring somebody in with significant experience so that that team can be back to where it was a few years back. We've lost decades and decades of experience in just, my short time on council. That's it.
Thank you.
Thank you.
Councillor Hollingsworth and Councillor McDonald.
If you had an unlimited budget, let's start with this. How many planners do we have currently?
Currently, I'll say we don't have any that hold a certification at the moment.
Let's just, so we don't actually have any planners in our planning department.
We have none that hold their professional RPP designation. So none are like have their planning certification. And so with the outside of Mr. Boileau, who's been generous to work, increase his commitment to us to 2 days a week. But he is the only one currently right now holding his professional planning designation.
How many warm bodies do we have in the department, maybe is a better question.
Yeah. At the moment, we have 4.
4. So no planners except for a person who wants to retire holding the fort. Interesting. How many planners, if you had a magic wand or unlimited amount of revenue, how many planners would you like to have in that department?
Certainly the more the better. Through Mr. Mayor, I would say 2 would be, talked about historical staffing levels where we've had
4
3 or 4 that have had 10, 15 plus years experience. But I would say ideally 2 would be close to like a minimum level. But in
Let's
the past,
go with a
we've had
maximum.
4.
How many would you like if you had a maximum, in which case you could do what you need to do properly?
I would say it'd be the young staff that we currently have certainly have lots of potential and very ambitious and lots of room to grow. I think combined with them, again, an additional
6?
Well, 6 would be a lot, but probably an additional 3 planners that would help, again, mentor these young staff, allow them to grow into their positions, would be certainly a very fortunate situation to be in compared to where we're at now.
Councillor, if I may jump in.
Yeah, please do.
Since Mr. Boileau's retirement, even with the manager role, the individual, we've had no planner on staff. So you're asking Mr. Faltrup immediate questions, but as they relate to the last 6 months, the last 8 months, they've not changed. We've had an individual in the manager role, but they were not a certified planner.
Okay, so maybe I can clarify where I'm going with this. We talk about building things, and we want houses to be built, but our planning department is, well, let's go right to it. Our planning department is inexperienced and probably somewhat understaffed, right?
Correct.
My point is, we're talking about a budget deliberation right now, and I'm prepared to make a motion to hire more staff, like create more positions. I realize there's a shortage, but I'm prepared as one member to make a motion to have more staff. Now, last year, before our CAO's time, when I asked the interim CAO if he needed more staff, he said, no, everything's fine. Clearly, that doesn't seem to be the case. So the question I'm asking is, do we need to create more positions in that department?
And Councillor, I'll jump in on that. So Mr. Faltrup and I have been working with Mr. Stevenson. We have a number of immediate strategies to have postings out to backfill these certified positions. In the meantime, we've worked with local municipalities, including Hawkesbury, including Kingston, with consultants who've done that similar work for similar sized municipalities who can cover our immediate needs while we look at the department's needs overall. What's difficult is that it is a profession that is quite competitive. Many from the profession have gone to the private sector for a number of reasons, and we are, prior to Mr. Faltrup's in the role, I've had similar conversations with Mr. Boileau. These have been positions that have been impossible to staff with certified staff. So we'll continue to work with HR. If there are opportunities, I know the Councillor Abel was speaking earlier about options to make the roles more enticing. I can assure you that Mr. Faltrup and Mr. Stevenson are looking at all options. So we'll look at job postings. We'll look at contracted services, and we'll certainly continue to keep council apprised. We're not in a position today. You give us more position, we're not filling them because we can't even fill the ones that
I
we have empty.
recognize that, but the point is, if I don't give you the positions, and I say we don't create the positions, even if you had enough people available, if council doesn't approve it, then you can't do anything about it without waiting for us. I guess I'm trying to give you carte blanche here to hire the amount of people you need.
And our immediate solution to that, Councillor, is the postings, which will do a lay of the land of what's out there currently, and contracted services with professional planning firms.
Okay. The last thing I want to add, and I don't know who wants to tackle this, but when we needed to find a manager of the water treatment facility back in late 90s, there was a huge need because the whole Walkerton disaster, there was a giant amount of pressure on municipalities to fill these positions with the appropriate people and staff them. There wasn't a lot of people who were trained, and so we had to change our pay scale to make it more attractive. And in fact, if I can remember correctly, the water treatment manager was getting almost as much as the CAO simply because of the principle of supply and demand. Are we looking at doing that? Let's face it, money does sometimes motivate people. Are we looking at configuring our schedule, our pay? And I realize you're on a pyramid and you've got to watch how that sits, but are we considering doing that to try to make us the preferred location?
It's a complete strategy. Mr. Boileau and Mr. Faltrup had worked with good intentions to retain staff that would work towards certification. The individuals that remain in the department have that progression goals. In the meantime, to fill our obligations, we will go to contracted services. And Mr. Faltrup and Mr. Stevenson are working on the types of posting that will give us the best pool, including salary range, including opportunities to fill those vacancies. And when I'm saying those vacancies, there's it looks like one FTE, but the reality is, if we can pick up if we can pick up someone that is certified, even at a planner level, at a senior planner level, at a manager, all options are on the table at this point, and their services can be welcomed and supported throughout the organization and with consultancy services.
Well, let me leave this with you to whomever wants to wade through this. The strategic planning session said we want houses built ASAP. We have the United Way telling us how they're going to try to fix our housing issue. So that being said, please don't tell me at the next budget deliberation I'm going to have to hear we're short and we don't know what to do about it. Please don't let me hear that. If so, then it's going to be a somewhat unpleasant budget deliberation from one member's perspective. Thank you, gentlemen.
Thank you.
Councillor McDonald and Councillor Good.
Thank you, Mr. Mayor. So my question has to do with the reduced budget for salaries in that department. From this respect, I know sometimes we get budget reports, and usually at the end of the year or whatever, and we see that there's excess money there because we lost staff and didn't replace them. But in this case, I think this is a department in crisis. So why aren't we budgeting? If we do find somebody next week, there's no money here to pay them. So how do we do that? Maybe that question is for Ms. Bailey.
Through you, Mr. Mayor, I believe the positions are in the budget. They're just at a different pay. So our more senior positions have left the corporation. They were at the top of the grid. We have newer employees. But I think to Mr. Fothrup's point, the 5 positions are budgeted for.
And yet we've taken $45,000 out of that department. We still got enough to pay for somebody else that we could bring on if they're out there and willing to come here to work.
Through you, Mr. Mayor, there is budget there for the current staff, as Ms. Bailey mentions, as well as one additional FTE for a planning manager. But the reduction you're seeing is is, as Ms. Bailey mentions, is the difference from what we were paying these more senior staff that have, were at the top of their pay range, that have retired from the organization, and we've only been successful at replacing them with more junior staff that are really early on in their career towards the bottom of the pay
But we're looking for
scale.
somebody who's beyond the junior years. We're
right.
looking for somebody with experience, and so anyway, okay. If you come to us and say you found somebody, you need more money, we're here.
Councillor Good.
Thank you, through you, Mr. Mayor. I'm trying to remember where I wanted to go with this. And I don't want to get too deep into the HR stuff, but I have two questions in regards to just the recruitment for a planner. One, have we enlisted any kind of recruiting firms specifically for these positions?
Through you, Mr. Mayor, no, not yet. We are working with our HR department, and so that recruitment effort is really just about to begin.
Okay. And my second question, which honestly doesn't just relate to this role, but relates to other roles in the organization, in terms of just perks outside of pure salary increases, have we reviewed flexibility in terms of work from home, flexible schedules, and things to that effect?
Councillor, I believe your question is broader than Mr. Faltrop's area.
So I kind of
and-
turned my...
Mr. Mayor, I'm in your hands. We can certainly open it to questions, but I want to make sure that the team members are... Mr. Faltrop's been on the bench for some time, so perhaps we can...
Jamie hit the showers. No, Thank you, Mr.
Just want to be
Falthrop.
fair
Yeah.
to the team member
No,
and
for
open it
sure.
up.
Yeah,
We
sure.
will certainly respond.
I think we're going to stay on your question right now, Councillor Good, but what we'll do is we'll allow Mr. Falthrop perhaps to retake his seat and then call on Ms. Bailey to, I don't know if you want her, Ms. Bailey, if you want to take
Well,
some-
I just wanted to Councillor Good's question. So, as you know, there's currently an audit of various functions within human services that are being, human resources, that is being conducted. That includes a lot of these areas of flexibility of work, of looking for us to position ourselves as an employer of choice. So turn it over to Mr. Stevenson to add to some of these elements.
Thank you, through you, Mr. Mayor, to Councillor Good. Certainly, we all can, and we utilize other forms of distribution to look at what other cities are offering. And we use that in the sense of what are those factors that create the employer of choice? Because I think every city wants to be that employer of choice and get the best employees that we can get. I can assure you that our postings are certainly taking a different spin. The offerings of working from home, the offerings of flexibility, the offerings of certain ideologies that may not have been thought of or looked at in the past, we are bringing forward. And we're also very keen on what else is happening in the landscape and looking at drawing in some of those features. So it's more than just money, and it's more than just vacation. There's many things that we have to look at.
Wonderful. Thank you for your response. You know, I know we've lost several planners recently, but if someone can make a higher salary working for the city of Ottawa and they only have to go in 1 or 2 days a week, it's really hard to keep them. So I'm glad that that's being considered. I'm not going to get into it anymore. I'm excited to see what comes from the HR review.
Yeah, and I want to be candid on that. I mean, the history of just taking an org chart and backfilling vacancies is likely gone, and that's the conversation we have to have as the future state of the organization and looking at how do we position it to be an employer of choice.
Okay, I have Councillor Gardner next.
So we're into general questions, right? It's to do with job fairs and the money that we had to try to pull away from Mr. Peters. The question that should have been asked was how many positions were filled in Cornwall with the out-of-town job fairs, and what was the cost? Because if there was very little positions that were filled, and it's costing us a lot of money, I certainly would rather see the money go to universities for engineers, architects, those type of folks. Those should be recruited from, including doctors from university. The other thing is, are we using the colleges? Because tradespeople are in demand. Money would be better spent in dealing with colleges for recruitment for, just an idea would be shovel runners, electricians, certified electricians, tradespeople. Would be better to go to the colleges to get those kind of people, to recruit those people, than to spend money in Montreal or Ottawa or any other city that we went to in 2023 and got nothing out of it. So the answer that I want to know is, how many people did we recruit for our positions, and where were they from, and how much did it cost? So the CAO wants to answer. Mr. Peters?
Mr. Peters?
Thank you, through you, Your Worship. It's fair to say that, excuse me, that our job fairs were successful in bringing people to Cornwall. We know anecdotally from a number of employers that they were able to successfully recruit people specifically that they either met or as a direct result of those job fairs. Even locally, I can tell you that we had over 60 employers, including the city, at the Cornwall Job Fair, and we had 1,100 people attend that fair, and that was an opportunity for job seekers to speak directly with recruiters, hand their resume off, and in many cases receive interviews or promises of interviews. It's difficult to track across the city and across the various employers as to how many people that actually accounted for in 2023. What I can say you that I agree with your general premise is that we have an opportunity in working with college and university students that are graduating with the skills that our local employers, including the city, need. I would point out that our local college has a very limited range of available skilled programs due to provincial legislation, I guess, that governs colleges and universities in Ontario. And so in many cases, the skill sets that we need, including, as we just discussed, planners, those students that are graduating from in those disciplines aren't graduating in Cornwall, they're graduating from other universities and colleges. And therefore, whether it's an engineer, a doctor, or a skilled tradesperson, many communities have to look beyond their borders to recruit those people to available positions.
But beyond Cornwall and the job fair here, more specifically, I'm talking about the job fairs you go to in Montreal, in Ottawa, all those places. What was the cost and how many came from there rather than the job fair in Cornwall?
So in general, again, through you, your worship, the average cost for a career fair at a university may be as little as a few $100s. The average cost of a job fair is around $2,000. What I can tell you is that we met over 10,000 job seekers, and we handed them detailed information on available jobs in Cornwall. And I can also tell you that the job boards, not only the Choose Cornwall job board, but other job boards in the community, including Job Zone, saw significant increases in activity as a result of those efforts. And so our role was to connect the job seeker to the opportunity. It's ultimately up to the employer to connect or to seal the deal, to close the deal, and to offer that job seeker an interview and potentially offer them employment if it's a good fit. Not that we've specifically mentioned it, but another avenue that other employers are searching in this city at least is using recruitment agencies that will bring in workers from other countries that land in Cornwall as either permanent residents or with work visas. And so we've seen many employers bring in 10, 15, 20 workers that meet those qualifications, meet their needs. And so those are specific. The city of Cornwall itself, or our department, has not been involved in those efforts other than to generally support our employers. But the numbers are rather significant in terms of each job fair, I would say, ranging between 500 to 2,000 job seekers that we would individually connect with.
But how many do we recruit? That's the one
I
question.
don't have the number for that, unfortunately. I can, anecdotally, I can tell you that, we had employers offer job offers at job fairs to employers, to job seekers, but I can't tell you, and even on the local job fair, I don't think we had that specific stat available to us. Many companies simply won't provide that information.
Okay, and the last comment I'm going to make is university educated people, whether doctors, architects, whatever, how many of those people would go to a job fair?
So again, through you, Your Worship, when it comes to medical recruitment, our team has been involved in working with other community partners, including the hospital, on attending medical recruitment specific fairs. They may have different names, but basically they operate in many cases the same way. You have municipalities talking to future doctors or graduating students from medical programs, other medical professionals, and they're all trying to entice them either to a job at a hospital or a job in a community. And those targeted industry-specific fairs, to the best of my knowledge, are usually restricted or are more popular in the medical professions field. We have heard anecdotes of engineering firms descending upon a graduating class of engineers, inviting them all out to the West Coast, and then offering all the graduating students jobs. I'm not sure the city's in a position to do that type of thing. I'm not sure we need 25 engineers, but you can imagine that the competition for talent is extremely significant, and therefore companies are being more creative. Specifically medical recruitment, it happens all the time.
At the end of the day, the reason I asked the question, and I won't aim this at anybody else, but why was that brought to the table? And I'm not asking anybody to answer that. Thank you. That's an education and a half.
Councillor McIntosh?
Yeah, I want to go back to the planning department and the vacancies and that. We've lost 3 planners since I've been here, Carl Doyle, Alex Gatchian, and now Lindsay Parisian. Do we do exit interviews?
Councillor, I don't know the 2 individual prior to Miss Parisian, but just to be clear, Miss Parisian was not a certified planner. She was the manager in the function, but I'll turn it over
I'm just wondering, even if anybody leaves, do we say?
I'll turn it over to Mr. Stevenson for response.
Through you, Mr. Mayor, to Councillor McIntosh, yes, the simple answer is we do.
Okay.
And we find it's super important for several reasons, but as you could understand, it's to understand what were the triggering factors, and to understand what they believed was going on within the department and what we could do as a corporation to make it better, and accessing a lot of that information. So yes, we do them.
Yeah. I heard a couple stories, I'm not going to repeat it because it's hearsay. I didn't hear the person themselves say that. Somebody else told me why this one person who's went to South Stormont, and he had told his friend that why he left, and it was because he didn't see any advancement in the city. Anyway, interesting. Anyway, back to the recruiting thing. Bob, when you, through you, Mr. Mayor, to Bob, when you talk about job fair and career fairs, a career fair would be going to the universities and colleges?
Through you, Your Worship, yes, a career fair is typically defined as either at a college or a university, and a job fair is generally more open to the general job-seeking public, which could range from students to people just shy of retirement age.
I just wonder how many universities you would visit in a year. In Ontario, of course.
Through you, Your Worship, 2023 was a unique year because we had funding, specific funding to offset the cost of that effort through the RED program. But generally speaking, we would attend, between 5 and 10 overall between job fairs and career fairs. Because of the unique nature of career fairs and the low cost of them, we tended to increase our efforts in that area, and we thought that we had a better chance of our message being well received by a young person that wasn't tied to a mortgage or.
Yeah. Just on a personal note, my daughter's graduating from York this year with an accounting degree, and she said Cornwall was at York University not long ago. 2 ladies were there, and her friend went to the booth, but she had a class, so when she came back, you guys were gone. But she said her friend was very impressed and was considering taking a job with the city. Whatever, I don't know what her discipline is, but so it does have some benefits. I know that's only one story. It doesn't capture the whole picture, but it does, I think, have some effect. In fact, when she found out my daughter was from Cornwall and what her father did for a side gig, she said, "Oh my God!" Anyway, I'm not getting into that. But anyway, some students do pay attention to this, and so it does have some effect.
Councillor Ba?
Thank you, Mr. Mayor. And on that note, I'd like to put forward a motion, if that's in order, and I can email it to the clerk in a moment. If that's are we good to go for motions?
I mean, we're at the end of presentations. Questions and motions are in order at this
All
time.
right. Motion to direct the Economic Development Department to resume workforce attraction efforts, therefore restoring the accompanying budget of $152,659. Additionally, the motion seeks to sustain ongoing efforts related to the Provincial Workforce Attraction Grant, preserving the allocated funds of $85,000. If I can get a seconder.
Councillor McDonald, you second that? Debate?
Yeah, absolutely. And I mean, I had a lot to say when this came up last week, and I think I won't provide much more comment. But it's interesting to note these anecdotal stories, like mentioned by Councillor McIntosh, that these efforts are working. They are catching the attention of folks, and at career fairs. So beyond just job fairs, university and college fairs, where you have educated folks who are looking to start off their careers, and we have a great community to welcome them. And it'd be a real shame to see some of that effort disappear, especially since there's existing funds to continue this work coming from the province. So it's, maybe this is a debate for next year, but as it stands right now, I think we're in a crisis. And yes, the municipality on its own is in a crisis in terms of workforce shortage. So is the community as a whole. And I think the Economic Development Department has a role to play in attracting folks to ensure that our local workforce and our employers are in a strong position to continue the strong economy that we want for our community. I know that this isn't something we specifically spoke about when at least I thought we discussed it a little bit during strategic planning, but I guess not enough for it to make it into our strategic plan itself. But we also didn't talk about paving roads and sidewalks and snowplow and all of those things, which are all regular operations of the city that we just assume would continue on. And I would assume, in the conversations we had during strategic planning, never did it come to mind that if we didn't really hammer the point that we would lose this work that the department has been doing and doing more so over the last few years because of the workforce shortage. And so I urge my colleagues, especially since there's funds allocated to this, to offset the. I don't even want to call it. It's not an increase; it's a reduction, right? So this specific department came in. I don't have it open in front of me, like minus 8 point something below last year, which I think if you add the funds that had been removed, we might be hovering around definitely somewhere below the 3% goal we had set for administration. So I think, the fact that we also need to build housing is really important, but when it comes to marketing efforts and campaigns to really showcase a certain product or whatever it may be, you can't just sort of give up halfway when there's still a need, and try to pick that back up in a couple of years once the other piece of the pie is built, so the housing, let's say, because then, we'll kind of be forgotten in those existing efforts. Sorry, I'm very easily distracted. So I'll leave it there, and I may have some comments to wrap up, but I really urge my colleagues around the table, I guess, really stressing that there's $85,000 to cover this piece of the pie as well.
Thank you, Councillor. Can
Thank
I drop
you.
you to send the motion to the
I
clerk,
will,
please?
I'll press that immediately.
And we'll get that on the screen for council. Councillor Ngunjo?
Yes, please, can we have it?
To Manuel, please.
Hard copy, please. Can we have hard copy of the motion?
Yeah, it's coming.
Are we able to print that?
We are.
Okay.
Clerk is able to.
Okay.
We have to do this for every motion?
Say again?
We have to do this for every motion?
You just print every single motion?
I didn't say every single motion, but there's an ask right now.
asking.
Do you want every single motion?
If it is possible, yes.
Something in the budget, you want us to,
Well, you wouldn't print it. The clerk would once she receives it.
I have to take it out and send it to me.
If I may, Mr. Mayor, I think I may have a solution to our, yeah.
Yes, that's right. Okay.
Okay, while we figure this out, let's continue on debate for the time being. So I have Councillor McDonald next and Councillor Good.
Thank you, Mr. Mayor. So before I address this issue, can I just ask that if people talk about anything specific in a budget line that they're addressing, that they call out the page number? Because like we're discussing something on page 143, and it just helps to, it's nice to have a screen, but that's on the wrong page. So that would help. So now, what I'd like to say about this, I think I spoke previously, and I addressed the fact that I think that
like in the system?
the
It's not-
recruiting
they're
we
not
do,
coming
which
up.
is part of economic development. I'll wait. Believe me, I want you to hear what I have to say.
Just clarifying the process. Please continue, Councillor.
Thank you. So I think that the work that economic development does is, it's really the engine that pays for and fuels all our programs and activities.
That's the same thing that
So,
happened with you and me.
I questioned on this page, the non-mandatory budgeted services and the medical recruitment line. So I thought to myself, well, how successful a program is this? And I inquired, and I found that it's an extremely successful program. But before I get into that, then I wondered where it was in the budget. And is our medical recruitment, is that part of the $45,000, the 7.9% that was removed? Or where else, where in our budget is medical recruitment?
Ms. Bailey?
Through you, Mr. Mayor, medical recruitment was not removed from the budget. It was reduced from the 2023 budget. So in
Where is it in the book?
It's in community services. So on page 176, you'll see a line item for medical recruitment scholarship. $100,000 has been included in the 2024 budget.
So we didn't even get to that except through, well, or did we?
It was mentioned during the summary I provided, and then a bit around the table.
Okay. So that's a separate line. It's not, our medical recruitment isn't part of this money that was removed from economic development for their workplace attraction.
That's correct. It's separate.
Okay. So even given that, to take $100,000 out of it, given that it was such a successful program, and I have a few stats to back that up, I'm thinking, after our discussion with Dr. Remiliotis and all he had to say about the fierce competition that's going on right across, certainly, well, it's beyond Ontario, right across the country, for medical professionals, why in the world would we reduce that budget? apparently, this is what the dividends it's been paying since 2001. We've had 10 medical scholarships agreements. We've had 42 financial agreements. We've got 4 graduates, if you will, of this program currently working in the city, and we've got 3 more coming this year. And this is at a time when doctors are in short supply and high demand everywhere. Why are we reducing this budget? I think that's extremely short-sighted. And apparently, our retention stats are really great, because if people do enter into one of these agreements with us, they have to stay here for 3 years minimum. And apparently, 75% of the people who do come here stay beyond the 3 years. So like, I'll say with regard to the, my feelings about the Cornwall Electric Fund, you know, the Progress Fund. It's like the golden goose, let's not kill it. Well, this has been an extremely successful program. Why are we diminishing it? I don't know who to ask that of, but I'm really upset.
Perhaps I'll start. I'm not sure that including $100,000 allows us to continue with the same efforts that we've had in the past. There is $846,000 in the medical recruitment reserve. Now, about 700 or so thousand of 100,000 of those dollars are committed, but they're committed over the 5-year period of paying out those $25,000, $50,000, et cetera. So there are monies there, and we felt, at least at the administration level, that contributing $100,000 would not reduce our efforts.
So we're not just going to spend the $100,000, we're actually going to dip into reserves if we need to.
There is a reserve there if necessary, and perhaps Mr. Fothrop would like to add some further commentary. It's a reduction from 2023, but every year we look at that reserve and look at our amount to the tax base, and we found that that was appropriate for 2024 for our efforts.
And I would like to hear from Mr. Fothrop.
Yes, through you, Mr. Mayor. The $100,000 does allow us the ability to bring on one additional scholarship candidate, as well as we have our program for physician relocations. So for an established physician to move their practice to Cornwall. So it does allow for, again, one of those agreements. The $200,000 submission would allow for an additional scholarship candidate, so 2 scholarship candidates as opposed to 1, and would allow for as much as 4 new recruitments. So it certainly would provide the ability to bring on additional physicians into the community should we be successful at finding some to come.
And where would we get the funds if we wanted to send Mr. Peters or somebody else out to the universities to meet people and recruit them before they graduate? Like, have we lost that ability? Because as he mentioned, that they do go to career fairs, they go to job fairs, they do talk to professional prospects as well as blue collar or
there are funds within that budget to allow for that as well, to allow for those recruitment efforts to come. However, if we do find additional candidates interested, our $100,000 funding allows for 1 additional scholarship candidate. Whether if it were $200,000, we would be able to find more, or be able to offer additional scholarship to others. The scholarships do come to council for approval, and so that is an alternative as well, that should a candidate be found, that we could potentially come to council for additional funds if necessary.
Yes, well, I guess I'd like to see more money up front to use rather than wait till we need more money and then we go to reserves, and that would probably take coming to council, and could be lost time when potential doctors are a hot commodity. That's all I have to say. Thank you.
Councillor Good.
Thank you, through you, Mr. Mayor. So in this budget line, this services and rents for economic development, it's at $469,000. You mentioned, Mr. Fothrop, that includes attending some career fairs?
Through you, Mr. Mayor, no. What I was referring to Councillor McDonald was the medical recruitment budget, not the economic, this is the economic development, tourism, and CBEC budgets.
So, okay.
Councillor, maybe I can jump in because
Please, yeah.
we're getting into a complex part. So as we work with different sectors and there are specific workforce, that it be for engineer, planners. Historically, we've done it a certain way. We're now looking to support as primarily our HR functions for our own vacancies. So there are different sources of fund. I understand where you're going with your question. I want to clarify that as a team, as a senior management team, as we need to recruit for the organization, we're not simply doing it in one perspective. And yes, it is a transformation of our workforce attraction, but that's part of the journey we want to work towards this year is really positioning the team and working with the team on those new strategies.
Great, and I'm glad that you brought forward the issue of human resources because I really do feel like this is a human resources issue, not an economic development issue. This budget doesn't drain what they have prior. I know as someone with a university degree that when I am looking for a job, I'm not going to a job fair. I'm looking online 99% of the time. If I happen to be in the right place at the right time and there's a job fair there, maybe I'll stop by. Now, maybe I'm not who the city's looking to hire, and I definitely am in a conflict in that position, but I feel like I do represent a demographic that the city is looking to recruit. So I'm speaking for myself in that right that I know my own job hunting strategies have shifted almost entirely to the online virtual sector. Not to say that there isn't merit in job fairs, but that I see and I can appreciate that pivoting and taking a different approach is something that I want to give the benefit of the doubt to all of the hard work that went into creating this budget and keeping it within a reasonable increase. I think for us to add back in $152,000 into this line is sending the direction to administration that we're not happy with what they've presented us. And I think that this has been done with a lot of thought and consideration to the implications. I'm frankly not prepared to support this at this time. However, I do have a question in regards to this last sentence here regarding preserving the allocated funds of $85,000. And maybe this question is actually to Councillor Bear. I'm not sure. Are we losing, like, is this basically, are we spending 152, but it would have given us, I don't know, 230 something?
Yes. Maybe Mr. Peters can answer, but from my understanding is that the department had received a grant to do workforce attraction for the community, not the city. So the Economic Development Department, from what I understand, doesn't recruit for city positions. It supports the entire economy, all of the outside employers. So they'll go to job fairs with Walmart and whatnot to support their needs. Our HR department does that work for the city, and maybe while they're at job fairs they can also promote what's going on here. So that's double whammy, which is great. But from what I understand, there was a grant that was received and there's $85,000 left in that grant to do workforce attraction. But if we are ceasing workforce attraction, we are foregoing $85,000. We're just gonna, so we'd be giving that back. I don't know. I think it's a provincial grant. And so we would be losing out on some of that funding. So I don't know if maybe it could be specifically explained to us what the actual difference would be in the budget if we were to add the 150 and some change, but then reduce the 85. What does that actually? What's the impact to the budget itself?
Okay, I'm just going to remind speakers to wait to be recognized by the chair before speaking.
Sorry, apologies.
And I do just want to see if there is a staff person who probably answer. Okay. All right. I will call you out. or I will try to. So, Mr. Mayor, through you, I'd like to answer Councillor Good's question. So, the team prior to the journey that I described earlier had applied for the Rural Economic Development Program. If you look online, the program is wide-ranging. It includes business retention, downtown revitalization, innovation initiatives, a number of pockets. Our team had submitted specifically for workforce attraction, which is one program, and there's a number of buckets. So I want to give the team the opportunity to discuss with the ministry opportunities, but in the financial proposal that you're looking at, we can't confirm that this funding is in place. We want to reshape the look of it, but we're comfortable that there's likely sources of fund provincially that remain for a number of economic development initiatives, but that we have to reshape our engagement with the ministry to discuss those.
Okay. So it's unknown whether or not we would actually lose that 85,000. It's possible that we'd be able to retain it for some of these other activities, but based on what is currently in the budget, it does not fulfill the requirements of the grant that we've received. Am I understanding that correctly? Okay. I don't have any further questions. Thank you.
Okay, I have Councillor Hollingsworth next.
Thank you, Your Worship. A little latitude. I'll try not to repeat myself for the rest. You won't hear from me the rest of the night. How's that? Burn my 6 minutes all in one fell swoop. I'm not going to vote for the motion, Your Worship. I get the whole marketing thing. Certainly, who doesn't want to market the municipality? The $85,000 is available in other vehicles and other methods, so we can still get the money. We're just changing where we want to use it. If you look at page 140, the community budget variance, the commentary specifically says transition year. And I quote, anticipating a year of transition, which means we're changing the direction of the department. We sat down for 6 or 7 hours on a Saturday and said, here's the things we want. When you tell administration what you want, their job, or we as a group say, here's what we want, you're telling them, go out and make this happen. That's how it works. We say, here's what we want, you go and make it happen. So, the senior team, and CAO along with the senior team has said, hey, we're going to try to do what you told us you want, but we're going to need some flexibility in terms of our budget to make those things happen. Well, you can't say, go do this, and then say, no, we changed our mind, don't do that. It's kind of unfair. The second thing is the majority of council, and I've heard councillors say, well, I didn't vote for that. Well, maybe you personally didn't vote for something, but the majority of council, which is where they get their direction from, said try to get to 3%. The majority of council, decision-making body, the majority of council said, go try to get to 3%, which in fact is what they've attempted to do. Well, you got to find the money somewhere, folks, and the preliminary discussion was about 11%, and there's no way I'm ever going to say to the taxpayers, hey, 11%, you're okay with that, right? Because I know what response would be as one homeowner with family members who homeowners. There's no way they're going to be okay with that. The last thing I want to say, part of the reason why I'm not prepared to support this one, and there are a few things that I think we can tweak in terms of some other requests, but this one's not one of them, is that last night somebody mentioned that they were prepared to forego a pizza for the sake of getting whatever it is they wanted. Well, the thing that I want my colleagues to keep in mind is this. If we raise taxes by 4%, so that means your tax bill has gone up by 4%, your water bill is going to go up by 4%. I can assure you that your electric bill will probably go up some kind of percentage. Your heat bill will go up, your Wi-Fi will go up, your food bill is going up. All of those things are going up. So it's not just 4% by itself, it's 4% plus 3% plus 4% plus 8% plus 2%. All those things pile up on the people who live in our community. It's not just one little tax bill, it's a bunch of bills. And we, in my humble estimation, have an obligation to try to help people manage that. They've said, we would like you to help us manage the costs of living. So this business of just saying, well, we'll just tax some more money on the tax bill, it's no problem. It is a problem, and I, for one, am not prepared to just say, just keep jacking up the taxes, it's fine. It's only one pizza. It's not just one pizza. It's a bunch of pizzas stacked up on top of each other. And I think that's the thing that we all probably are guilty of forgetting from time to time. And so, as I said, there's a few little tweaks that I think I could probably live with. I'll be quite candid. I'd like to see the library get a little bit of money to carry on. And I am partial to the Historical Society's event this year. I'll be crystal clear on that one. But to just say there are things that I'm prepared to get rid of to compensate for that, but to just say, well, just tack on some more money, I don't think that's fair, and I'm not prepared to support that type of motion in light of the fact that we said, here's our strategic plan, go out and work towards it. We've been told right here in black and white, we're transitioning. This is one department where we'd like to change where we're going with, and next year hopefully we'll have maybe a clearer vision. We're asking you to put a little faith, and yes, the majority said 3-ish, and I know we said, oh, we don't want to cut services. Well, that's naive to think that you're not going to cut anything. You can't come in at 11 and say, oh, we don't want, nothing's going to be cut. That's foolhardy thinking in my humble estimation. So I'm not going to support adding $160,000 to the budget, even though it's not a big chunk of money. In the grand scheme of things, it all becomes cumulative. And I think we need to start someplace at helping people out there manage their costs. Thank you, Your Worship.
Further questions, comments? Councillor Bennett, then Councillor McIntosh, then Councillor Gunjo.
Thank you, Mr. Mayor. Through you, I'll be very brief. Last week, when we had the presentation from Economic Development, some of us had conversations afterwards, and I thought to myself, yeah, I think I would like to see that money put back into that, and I was prepared to support a motion as such. However, I've had a conversation or two since that's made me see the reasons for the money coming out, and it's right in here as far as it's going to be a year of transition. So I don't have a problem putting a pause on the funding for the year, seeing how it plays out, see what the transition looks like, and next year at this time, if we feel it was missing, then I'd be more than willing to put it back in next year. But I think, to Councillor Hollingsworth's point, I think we need to give this year transition the opportunity to see what kind of fruit it bears. So basically, I've changed my mind from how I felt last week, and I'm not going to be supporting this motion.
Councillor McIntosh.
Yeah, I guess I'm old school, and I like face-to-face. And however, when I talked about maybe bringing the money back, my theory was, or my thinking was, that we could, if this is transitional year, we morph this in and keep it going and bring in the transitional part of it, and then next year maybe go in another direction. But I will not, my whole thinking is not adding money to the budget. It's to either hold it at 4.07 or reduce it. But my motion wouldn't have read that way. It would read that we find the money somewhere else and maybe cut it in half, find the money somewhere else in the budget. But I'm not going to add that kind of money to the budget. It's that's not the direction I was going in, and so that's that.
Councillor Gunjo.
Thank you, Mr. Mayor. I'm going to speak for the first time against this issue because I remember last week when this come up, I am the only councillor who did not speak about that. Everybody had an opinion, but I was like, something is going on, and I'm going to think before giving my opinion or my point of view. And I'm very proud, I'm very happy to see this motion now because it's giving me the opportunity to share with you what I think about this point. And I totally agree what my colleague, Councillor Dean, shared with us. We gave a direction. We made like a whole day of discussion, and after that we give to the administration a direction. And we are expecting this direction to be achieved. And I think when administration come back to us with a sort of budget, we cannot change this budget. We just have to support it. That is one point. But the key point for me, it's not about what we discussed before. It's more about our resident. I am aware of the cost, the life cost. Life cost is very, very expensive now. Water, electricity, internet, everything is getting high. And to be honest with you, I would like the budget this year to be increased by less than 3%, because I think, even if I know that it is not realistic, but it is a dream that I have, I think we should think about our residents. They are struggling. Life is very, very expensive. So when the administration gives us an opportunity to cut budget, and in a department or in a sector where we see a sort of inefficiency, because I was listening to Mr. Bob a few minutes ago, we still don't have enough tool to assess this program. We don't know how many, and I really enjoy the question that you bring on the table. We cannot assess the effect, the impact of this money that we're giving to this department to bring people in Cornwall. That is, it's a sort of dark thing. So it is the opportunity, the best opportunity that we have today to say, oh, stop, we can change, and put like a stop and try to see how things can be do better. So all that to say that I'm not supporting this, because it's an opportunity to me to decrease the tax that we're going to charge to our resident. Thank you, Mr. Mayor.
Further speakers? Yes.
Thank you, Mr. Mayor. Before I wrap up, I'd like to ask Mr. Peters, what are the odds the province would allow us to change the direction of the original grant application at this time?
Through you, Your Worship, the grant was rather specific. We have been in contact with them. They are open to the dialogue, but we believe that, although there may be some movement, it's unlikely that there be full movement. As the CEO mentioned, the program remains in effect, and there may be a better pathway to seeking a new application that better follows a new direction. We're in year 3 of a program, and so the majority of the funds have been expended. So, in my opinion, although they're open to that discussion, I think it's unlikely. It'd be more likely a better path forward might be in a new application.
Okay, so it's unlikely that we can reallocate that $85,000 to other work. So I don't know if it's appropriate. Could I amend my motion for it to only include workforce efforts related to the grant application, therefore being no increase to the budget?
Madam Clerk?
Councillor, I just wanted to jump in, Mr. Mayor, if you will. As you know, we have a new position in the organization through my team, the Director of Government Relations. So our team has not been able to engage with the ministry so far. I recognize Mr. Peters as long-standing relationship, but our intent is to reach out and seek some clarity on that matter.
Thank you. It sounds like there has been some clarity. So it's clear that this motion isn't going to pass. So I'd like to amend it to at least be the $85,000, and that the department can use the grant funds to continue this work until the end of the grant period. I'm assuming it's not till the end of the year, but at least sustain because there may be an opportunity to do some good work, and then if we don't, we may lose the funds altogether. Is that appropriate? So it would just be motion to direct the Economic Development Department to resume workforce attraction efforts in the as elaborated in the provincial workforce attraction grant, preserving the 85,000.
So through you, Mr. Mayor, an amendment is not in order because you're going right off like it's something completely different. So it would have to be turned down and then you can introduce that motion.
Would that be a brand new motion, or would there have to be like a
No, brand new motion.
Brand new motion. Okay, and so may I do that as soon as this one fails, Mr. Mayor?
I did have Councillor Good potentially next.
Okay,
in
that's
terms
fine.
of
I can try to
overall
bring it
debate. Yeah. Okay, are we all familiar with the motion that we're voting on? It's on the screen. Take a minute to read it. Okay, I'm going to call the vote on the motion. The mover is wrapped up. All in favor? All opposed? Motion is defeated. Councillor Good, I had you next prior to the motion being tabled.
Thank you, through you, Mr. Mayor. I have a motion I'd like to bring forward. It doesn't have any direct financial implications, but I believe that it is very pertinent to the budget overall. The motion, Manon should already have a copy of the motion. So this is, it was originally titled Review of Memorandum of Understanding. However, I think the title should be changed to Review of All Funding Agreements. It's a little bit long, so bear with me. Whereas the City of Cornwall is desirous of ensuring equity, transparency, efficiency, and sustainability in all of its activities, and whereas Council establishes policies pertaining to governance, and whereas the City of Cornwall has many contracts with outside agencies and community partners. Whereas the City of Cornwall values demonstrated environmental, social, and governance policies and practices of external partners, and whereas the City is desirous of adopting a consistent approach to external advertising for programs funded by the City of Cornwall. Now therefore be it resolved that administration review all funding agreements with external parties to A, ensure equity, transparency, efficiency, and sustainability. B, establish policies pertaining to governments and oversight of external parties, emphasizing accountability and alignment with city objectives. C, review existing contracts and MOUs to determine any financial or legal implications of discontinuing partnerships. D, consider demonstrated environmental, social, and governance policies and practices of external partners. And E, ensure external advertising for programs funded by the city prominently feature the city logo, ensuring clear identification of municipal support. Now therefore be it resolved that administration report back to council at a future regular meeting of council.
Just a point, this is very fine-lined conflict of interest, as the Social Development Council does have contracts with the city. I'm going to sit this one out. That's cool with everybody.
Thank you. Is there a seconder? Councillor Hollingsworth? Okay, we'll go to debate. Councillor Good.
Sure, thank you, Mr. Mayor. I brought this forward. Obviously, we were presented with this list of non-core, non-mandatory budgeted services, and I think it brought up that there are some uneven and or inconsistent agreements between these parties, some of which are very long-term agreements, some of which are shorter term. I'm thinking specifically the agreement around Altsville Theatre and the college, around the museum, around the airport, around Big Ben. And that said, all of the agreements, really, this is to ensure that we have oversight and consistency. And this is just to provide administration with that direction to conduct that review and come back to us with recommendations for how they see us being able to ensure that the agreements that we have existing are rectified in such a way that they can align together, and that agreements moving forward will follow some kind of consistent formula, we'll say, to ensure the following is considered.
Okay, I have Councillor McIntosh and Councillor Hollingsworth.
I wanted to see a hard copy.
Oh. Can we work?
Oh, there you go.
Asking you shall receive.
That's the paper man. Councillor Hollingsworth.
No local paper.
Yeah, you're up next, Councillor Hollingsworth.
Thank you, Your Worship. Never underestimate the value of paper. I'm going to support the motion, Your Worship, as Councillor Good alluded to. What has become apparent through this last round of discussions, and it was kind of always there, but perhaps we just never really gave it a lot of thought. We seem to be inconsistent. We have an agreement right now with the theater. We have an agreement with the Historical Society. We have an agreement with South Glengarry regarding the airport. And those are just a couple off the top of my head. I think there's at least 2 or 3 more. There's a couple of groups last night that seem to be looking for agreements. And I think what we need to do is I think we need to standardize our agreements so that moving forward, if somebody says, hey, wouldn't it be great if we have an MOU, we can say, okay, here is the standard agreement that we use for everybody. And you might tweak it a little bit. Currently, right now, the ones we have, and don't misunderstand, I'm not saying we need to cut these organizations. That's not the intention. What the intention is to A, clean it up, and B, when I made paper for a living, management would use references like best practices. And all I'm really looking for is to see us use best practices when entering agreements from those that we have moving forward. And I think reviewing them and saying, okay, here's how these work, here's what we need to do to maybe make them work a little better for us, and moving forward, this is how we're going to proceed. So that's kind of what I'm looking to see with regards to the report.
Councillor Gunjo, Councillor Gunjo's next, then Councillor McDonald.
Thank you, Mr. Mayor. I'm going to support this motion for many reasons. One of those reasons is that we are going through a new way, and we gave administration some, how can I call it? We gave administration a mandate, and now it's an opportunity that we have to try to be more efficient and to know how the money that we're spending through the association that we're funding is working in our community. We have a new vision, and I think making by this new policy, making this, working with those organizations is going to be a way for us to make sure that every single dollar that we're giving is first giving through equity, transparency, and efficiency, and secondly, to make sure that this money that we're spending through organization that we're funding is going to match the vision that we have of our community, of our city that we're trying to build. So I think it's a good opportunity that we have now. It's a new way, a new door that we're opening. And yes, it's an opportunity that we have to give a new direction to association or organism that we're funding, and plus to be equity and transparency with those organisms. So I'm going to support this one. Thank you, Mr. Mayor.
Thank you. Councillor McDonald.
Thank you, Mr. Mayor. I'm going to call for a motion to defer. This is a very lengthy motion, and I know we finally have it legible on the screen, but it's complex, and I think all the organizations that it addresses that we have relationships with deserve a bit more time than we've got right now in the middle of a budget exercise, especially since Councillor Good did say that there was no financial implication to this, I believe. Might be down the road, but there isn't now. And I'm afraid that in our rush to get through this expeditiously, we might overlook the fact that all these organizations are different, and I don't believe a one-size-fits-all approach would do justice to them all. And frankly, I mean, I'd like a timeout and a copy in my hand if I do have to vote on this. So I just think more time will do justice to the motion, because what I see here, this all sounds good. You know, environmental, social governance, yeah, those are all good things. But really, I would like to have a bit of time to read it in my own hand, and let's look at it the next council meeting, the council meeting after, whenever, please.
So you're making a motion to defer?
To defer.
Is there a seconder? Councillor Gardner, we're now debating the motion to defer. Councillor Good, then Councillor McIntosh.
Thank you through you, Mr. Mayor. I actually am totally fine with deferring it. I would like this, however, to be considered the notice of motion, and if it's possible to have this added onto our next agenda for our first meeting in February, I think that would be totally appropriate. There's no intention here to slip things in, but an intention to ensure that we do have oversight and a direction to administration to ensure, I liked Councillor Hollingsworth, terms of standardization and best practices, not a one-size-fits-all. Thank you.
Councillor McIntosh.
It's a well thought out motion. No complaints, right? And like Elaine, I need, you know, we talk about getting the agenda 5 days in advance so we can go over things. Well, here's a good example of something we'd want to sit at home, look at it, have a coffee, make a phone call or two, you know, that kind of thing. So I'm voting to defer it.
Councillor Hollingsworth.
I don't have a problem with deferring, Your Worship. The only thing I would suggest is kind of as already alluded to by Councillor Good. I don't want this like 6 months from now. I'd like to see it debated in the next, ideally sometime this month, well, February. So whether it be the next meeting or the one after that, plenty of time for we councillors to kind of contemplate the universe and all that kind of stuff. So, but I don't want it to drag in, because this will potentially have some budget implications for the next budget. And if we're talking about doing budgets again in November or thereabouts, it seems like a fair amount of time away, but probably not as much as you think. So I don't have a problem not doing it tonight for sure, that's fine. But I don't want it to be like March or April. Let's get it on the next agenda. And if the majority of council wants to push ahead with it, then great. Thank you.
Councillor Gardner, then Councillor Bennett.
Just a question to Councillor Good. Just a question to Councillor Good. We have a contract with Allsville Theatre for 20 years. You're not looking at making any changes there. You're making it, trying to make it a constant way to look after all our MOUs and our contracts.
Councillor Good.
Because anybody who wants to touch Allsville Theatre, don't talk to me. You won't get my support. So explain to me what you're trying to do here.
Councillor Good, you may answer.
Thank you through you, Mr. Mayor. Now, I'm going to leave that with administration as to the recommendations they come back to us with. I think it was very clear from our meeting yesterday that none of us have any intentions of doing something that would risk the, sustainability of Altsville and or any of the programs really that were presented to us. But I do think that if there are room within those contracts to make changes that would improve how the deal is for us,
Yep.
that'll keep it sustainable for them,
Yep.
I would be willing to definitely explore any of those opportunities.
Given what you just said, so am I.
Councillor Bennett.
Thank you, Mr. Mayor, through you. I saw this motion a little earlier today, and my fear was it was going to get defeated because it's requires a bigger conversation that wouldn't be allowed to happen tonight. So I'm in full support of the motion to defer, because I think it does deserve a full-on conversation with all of us having 2 weeks to mull it over in our own minds to get an idea what we want to see out of this. It is a good motion, and I do like it, but I'm glad for the deferral, because I'd rather that than see it defeated because we didn't have enough time to consider it. So I'll be in favor of the deferral.
Further comments? Just for clarification, will this motion come on the agenda for February 8th?
We're in your hands, really. It's a notice of motion.
I ask because that is the next council meeting that we have scheduled.
February 13th, and yes, we
Oh,
could
it's
put
the
it on there.
13th.
Yep.
Guess I should run that.
It's one of those, I think we got an extra week.
I'm here. I'm here all the time. I don't. Okay. Does the mover of the deferral want to wrap up?
I think everything's been said.
Okay. So we're voting on the deferral. All in favor? Okay, it's carried unanimously. Thank you. Motion is deferred. Councillor McDonald?
This is almost a point of order. Earlier in our budget discussions, we had asked Miss Bailey for some information, and she said she would give it later. And it seems to me, for the last two motions, we've moved beyond the information gathering stage into the motion stage. So I really think if we could backtrack and hear from Miss Bailey the comparison of the various municipalities around us and the rates that they've set, and also our history in the budgets that have been proposed to us and what we have finally passed. I think that would inform our further discussions.
You raise a good point, Councillor. I'll take responsibility for overlooking that. You are correct. Miss Bailey does have those reports.
I think it just happened, yeah.
So, yeah, I'd be happy to have Miss Bailey explain those and
Great.
bring those reports back. Miss Bailey?
Through you, Mr. Mayor, yes, we sent the information out by email just before the meeting started, so around 2:10, so it'll be in your mailbox. And it has been posted to the city's website, I believe, by the clerk. So we can take a look at it in summary now, and then maybe bring back if you have any further questions. So the first report was a 2024 budget comparison to other municipalities. And we did collect information from 86 municipalities through online searches. So we used the Municipal Information Network and municipal websites, and from a survey that was conducted and shared by another municipality. Of the 86 municipalities, 46 had approved their budget, and 40 municipalities provided information of their draft budget. So in comparison, and here's the chart right here. You can see that the City of Cornwall, we have a tax rate increase of 4.02%. Yeah, bring it down a little bit, maybe. Bring it down. I'm not sure who is, here we go. So the City of Cornwall, you see going across the first row, 4.02%, 4.07 for a net levy increase. The net levy increase was the 3% direction. The increase for $100,000 of assessment is just under $65, 4% to the average property here in Cornwall, and the average property increase at about 115. So you've seen that information already through our presentations. The next section is about the approved budgets from those 46 municipalities. So you can see how their tax rate will change. So the average 4.87, the median 4.44, highest is 17.8, lowest is 1.7. And then the comparable numbers going across for the net levy increase to 100,000 average property, both in percentage and increase. We separated those municipalities, those 46 municipalities, by the 40 municipalities that hadn't approved a budget yet, just because there may be changes to come from their councils. So the information you're seeing there is the same thing. For a tax rate increase, 4.52, median 4.44, 7% right now is the highest and lowest is 2.56. Sorry, those are approved. I apologize. We remove the highest and lowest because sometimes that skews the numbers. And then we have the budget as the last.
Microphone, sorry. Yeah.
Would it be possible to get a printout of this?
I think the CAO may be getting one right
Oh,
now.
good.
I asked them to explore that.
Thank
Do
you.
apologize.
Thank you. So, now.
And perhaps maybe I can explain the next reports as the printouts come, and then you'll have this evening, tomorrow, to take a look at them, and if you have any questions.
Yeah.
Another inquiry that we had, request for information, was regarding legal arbitration grievances and negotiation costs. So that stemmed from a recommendation by administration to staff, a municipal solicitor and legal clerk that we've included in the 2024 budget. As part of the report, we provide some information of why we're making that recommendation. And then on the second page, once you have the report in front of you, you'll see the costs that the city has incurred in 2020, 21, 22, and 23. It is important to note that the city does report to council on these matters when we have variances to budget, so that's been noted in the report too. The third report of information was to provide for 2020, 22, 2020, 21, 22, and 23, the comparison between where council had a budget submission and then how the budget was approved. And so that information is there for council to review. And the last one was a question on site-specific Heart of the City Community Improvement Plan program for those 6 sites in Le Village and downtown, and the parameters of that program, and how we are going to ensure that over that 20-year period of the tax increment grant, that the apartments in those buildings remain affordable, and what those agreements look like. So a lot of information, so perhaps best to take it away, since I'm sure we're going to be coming back tomorrow, unless there's any questions.
Councillor McDonald?
I would like to move that we adjourn, either get printouts here or print this out at home, and because I think this is information that will inform our debate, certainly, on the overall budget numbers.
Councillor Hollingsworth?
If that's the motion, I'll support the motion, Your Worship.
I'd just like to point out that if we adjourn, we're adjourning our budget deliberation, so it'd be a recess again until
Okay, well,
tomorrow.
then
But if we're all in agreement, that's...
Well, just as a comment, I agree that it seems like we still have a lot of things to try to make sure we know what it is we're doing. And typically I'm always one to push ahead and try to get to the finish line, but I don't think we're gonna be there tonight. And I think we're gonna- I don't think we're gonna get there tonight, so rather than try to half bake it, it might be better to regroup.
Councillor Good, you had your hand up.
Thank you, Mr. Mayor. I was just hoping, because I am assuming tomorrow we're getting right to it. I have a couple of, and maybe I can ask that, I'm assuming there will be some questions that come tomorrow, but I have some questions about these documents that Ms. Bailey provided us. So
Yeah.
will there be an opportunity at the beginning of tomorrow to
We'll-
ask some of those questions?
Yeah, we'll start off with questions regarding the reports that are being, well, it looks like the clerk has copies now that are being handed out or that you have electronically. And as these are part of the larger budget, as we continue debating questions, you can still refer to them and ask questions on them for greater clarity. Councillor McIntosh?
Yeah, a couple of questions for, we didn't finish up on the medical recruitment thing. I, a couple of insights, questions. I can resume that tomorrow then?
Yes.
Okay, and Mrs. Bailey, you exceeded expectations. Somebody told me that, somebody who watches us on TV said, that numbers woman, she's really good.
Okay, council, so thank you for today. So we'll officially recess at this time. If you need a printed copy, please be sure to collect one. I want to say collect one on your way out, but no, please collect one, and then we'll resume tomorrow at 3 p.m. We'll start with the reports from Ms. Bailey, and there'll be an opportunity to go into more in depth, and then we'll continue our debate, questions and motions. Have a good night.